I also see Deputy Mayor Morley's online and Councillor Perks is online.
Good morning.
Good morning. And in the room, we have Director Zhao and Director Ozude is here as well. And I see Director Trandrabalans is here. Okay, so we do have quorum, so we'll begin. So good morning, my name is Councillor Chris Moyes, and I am the Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I will call meeting 14 of the Board of Health to order. And again, welcome to everyone. Today's meeting is being held by video conference and in person at City Hall in Committee Room 1. Because we are meeting in person and remotely, we ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call you speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. Please note the speakers list will close at 10 a.m. this morning. We have about 30 or so people on the list. The Board Secretary has provided all agenda materials on the toronto.ca/council and via CMP and the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or motion, I ask the directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motion by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges that the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is home to many diverse First Nations, Inuit, Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges that all treaty peoples, including those who came here as settlers, as migrants, either in this generation or next, or past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand and unmute your mic and indicate the item number and the nature of the interest. Seeing none, next we need a motion to confirm the minutes from our last Board of Health meeting on May 27, 2024. Councillor Bravo. All those in favor? Opposed? Carried. I haven't had a coffee yet. I know. The motion carries. So, as usual, June was a busy time for Toronto Board of Health. We celebrated Pride and marked the first day of summer, but the dedicated work did not stop amidst the festivities. Today, we will receive the Toronto Public Health Strategic Plan 2024 to 2028, which has been in development over the past several months. I would like to thank the Strategic Plan Development Committee and the Toronto Public Health staff for all of their hard work engaging the public in consultation and using feedback to shape a comprehensive plan that will guide our work over the next 4 years. Thank you also to everyone who shared their input at the community consultations and through the public survey. This new plan reflects the city's ever-evolving population health needs and ushers us to address public health challenges through the social determinants of health and a health equity lens. One of the priorities laid out in the strategic plan is strengthening health protection, disease prevention, and emergency preparedness. With the beginning of summer and heat warnings in effect, Toronto Public Health has already exemplified what this priority looks like in practice by communicating to the public about heat relief and preparing for the threat of wildfires. Later, we will receive an update at this work, specifically the wildfire smoke response strategy, which was launched last June. The strategy ensures that the roles and responsibilities in the event of a wildfire are clear so that response can be as swift and effective as possible. It has also been updated to incorporate learnings from last year's unprecedented wildfire season. This is the last Board of Health meeting before September, but our work monitoring health trends, delivering critical services, and helping Torontonians stay informed about pressing public health topics continues. As we enjoy the rest of the summer with friends and family, let's practice community care by staying mindful of local COVID-19 and Mpox cases, and by checking in on each other during extreme environmental conditions. Alrighty, and Dr. Davila has no comments today.
I have a lot to say for the rest of the meeting, not to worry.
Yes, and so we'll move on to the rundown. So item HL 14.1, Toronto Public Health Strategic Plan 2024-2028. There's a staff presentation and registered public speakers on this item, so I'll hold it down. Item HL 14.2, update on Toronto Public Health Wildfire Smoke Response Strategy. There's also a presentation on this item, so I will hold it down as well. Item HL 14.3, Toronto Public Health 2024 Risk Management Report. There are registered speakers on this item, and I will hold it down for that purpose. Okay, so we will go back to HL 14.1, Toronto Public Health Strategic Plan 2024-24. Actually, that's right. The clerks remind me that I do have a motion, and the motion is actually to end the speakers list at 10 a.m. Registration. Thank you. I will move that item. All those in favor? Opposed? Carried. Thank you. I also see that Trustee Shrishkan Raja is also online. Thank you for joining us this morning. And I'll turn it over to Dr. Davila to introduce the speakers, or the presenters.
Actually, it's me. So good morning, members of the Board of Health and members of the public. Thank you once again for joining us for this Board of Health meeting. As mentioned already by our chair, I'm very pleased today to be presenting to you on Toronto Public Health's strategic plan for the period 2024 to 2028. So I'm going to take you through a slide deck. If we can get to the next slide. Just for the members of the board, you'll probably recall that we kicked off this conversation regarding the development of a new strategic plan back in October of last year. And again, by way of reminder, having a strategic plan that covers a roughly 3 to 5 year period of time is one of the requirements of the board under the Ontario Public Health Standards. So with the direction of the board, we have been working with the Strategic Plan Development Committee, as you heard from Chair Moyes in his opening remarks, to develop this new strategic plan. And of course, that involved extensive research and consultation. So on to the next slide, just to give you a sense as to the kind of presentation we're going to be having today. There are 3 parts to today's presentation. First, we're going to review the development process, again, at a very high level. You've heard about this already before, but just to give you a bit of a reminder on the development process, also looking at the engagement and feedback processes that were engaged as part of the development of the strategic plan. Then I'll actually share the plan with you. You've seen some elements of it already, but we'll get to all the details of the plan such as it is developed at this point in time. So you'll see the mission, the vision, the values, the priorities and objectives. And then finally, we'll move into next steps in respect of implementation and how we will monitor progress on this plan over the next few years. So on to the next slide, we're into the component, part 1 of our agenda, reviewing the framework, the timeline, and the engagement activities. Next slide. You'll recall that we did use a general framework of the Washington Nonprofits Institute. It actually sets out 3 major steps in respect of a strategic planning process. First, organizing, then imagining, and launching the phase which we're very excited to be entering today officially. Next slide, a little bit more by way of detail on what specific activities were undertaken within each of these steps. And we are now entering the launch phase, as I've mentioned, or the launch step, and specifically the execute phase, where we're presenting the strategic plan to you. And I think this is a very exciting moment for us. But before we get into the actual plan itself, just a little bit of a review of the research and engagement activities that were part and parcel of the strategic plan development process. Next slide speaks to the jurisdictional scan. Again, really good to learn from others that which is already out there in respect of strategic plans. This was done through a jurisdictional scan which involved 60 documents looking across a variety of organizations across North America and internationally. And you can see what themes on this slide emerged from that jurisdictional scan. Next slide. Of course, in keeping with our practice of being evidence-informed and making sure we're addressing the needs of the population, a key resource in terms of the strategic plan development was, of course, the 2023 population health profile. This was presented to the board and again speaks to the kinds of health issues that are actually impacting on the overall health experience of Toronto residents. Next slide. We also met with a variety of community-based organizations, prioritizing in particular organizations that are situated in the north and west end of the city and in Scarborough, and those organizations that serve particular priority populations, including those from our African, Caribbean, and Black communities, 2S LGBTQ+ services, individuals, so organizations that serve those individuals, seniors, women, those with disabilities, and the newcomer community, including those of Eastern European descent. Just a reminder again to the board that these areas of the city and organizations serving those particular populations were prioritized because during the pandemic, it was highlighted that these were underserved areas and had greater need. And so we sought to make sure that those particular perspectives were well looked after. And as you can see on this slide, there were some priority themes that emerged through those consultations. And then finally, next slide, we of course consulted with the members of the Board of Health and incorporated the many valuable insights that we gathered through our one-on-one engagement with each of you. You'll see here on this slide, but I'll take you through very high level the kinds of things we heard about that you talked about as important in terms of needing addressing in the strategic plan, included such things as mental health and substance use, important issues like food insecurity and housing, vaccine uptake, nutrition, newcomer health. Again, priority themes that emerged through our conversation with you. Next slide. Of course, we also considered other strategies and ongoing work that is happening at Toronto Public Health. The board will recall that late last year, November to be precise, we launched our mental health strategy, or the city launched a mental health strategy entitled Our Health, Our City. This is the city's cross-cutting mental health and substance use strategy. This kind of work and the work and recommendations under that strategy clearly formed part of our thinking as we developed the strategic plan in concert with the Strategic Plan Development Committee. And of course, we have obligations and services and collaborations with our Indigenous communities and Indigenous service provider agencies throughout the city. You will note that as we go through the strategic plan, there is not specific mention made of serving Indigenous communities or collaboration with Indigenous service providers. That does not mean that this plan doesn't apply or that there can't be benefit for our Indigenous populations, communities, and partners in respect of the strategic plan. What it does mean is that it is reflective of our commitment to decolonization and to self-determination. We have established an Indigenous Wellness Committee. I spoke about that to this board already, and it is in that process that we see more of the work happening in respect of advancing, promoting, and protecting the health of Indigenous communities throughout the City of Toronto, and of course, our collaborative work with Indigenous service providers will really happen at that table, at that wellness committee, and of course, work back and forth, work synergistically, if you will, with the strategic plan as well. Next slide. Again, to give you a sense as to the engagement overview, further engagement overview, we know that starting in February, and you will have heard this before, the Strategic Plan Development Committee helped to guide our staff in starting an engagement strategy so as to further influence the development of the strategic plan. On the slide, and as we've discussed before at this table, there's a series of engagement activities that were undertaken, surveys, a dedicated email address for people to provide input, public consultations, and a town hall. There were also a number of meetings held with Toronto Public Health staff and with other city division partners upon request, in order that we could solicit feedback from a variety of different people, agencies, and organizations. The next slide delineates a little bit more by way of detail in respect of the engagement activity. You can see that there were over 1,400 individuals who provided us with feedback, more than 60 organizations that also named themselves and provided excellent feedback and insight into the development of the strategic plan. And on the next slide, you'll see a list of the many organizations that actually named themselves in respect of our undertaking. So with that, the next slide, I think the moment that many of us have been waiting for, the actual strategic plan for 2024 to 2028. Before I delve into the details, if I may echo a note from Chair Moyes, I would really like to take this opportunity to thank the Strategic Plan Development Committee, chaired by Councillor Bravo, Vice Chair Bravo. This committee provided us with invaluable leadership and collaboration throughout this process. I would also like to take a very brief moment to thank the key members of the Toronto Public Health team who actually made this possible. Over to my right and ahead, one of our amazing Toronto Public Health directors, Upala Chandrasekhara. I see right behind her Vanessa Fletcher and their whole team. Incredible work. I will detail some of the specifics of the remarkable work that they have done in order to bring us to the point where we are today, ready to share with you the strategic plan for Toronto Public Health. And, you know, without further ado, let's get on with it. So, next slide. Just a reminder of what the components of the strategic plan are. This kind of framework is what we use to help shape the strategic plan. As you'll see, each level of the structure feeds into the sections above it, and you get more specific in terms of the elements as you move down that pyramid. Going to the next slide, at the behest of the committee, the Strategic Plan Development Committee, we've included an introduction as part of the strategic plan. This was a discussion that occurred at the committee that it was felt that it was really important that while many of us here in this room feel that we understand, right, what it is that public health is, many perhaps don't understand, and it was worthwhile thinking about providing a definition of what public health is, the value it brings, and providing information for public consumption on how public health aims to maximize health status by preventing disease spread, promoting healthy living, preventing injury, and advocating for health-promoting social, environmental, and economic conditions. Information on how public health aims to understand and influence upstream conditions that shape our health. Things like income and housing, which are absolutely vital to health, and to create more health-supporting environments. You'll see brief mention of how public health collaborates across sectors and advocates to improve the factors that impact health. Discussion of how investments in public health contribute to a healthier population, a population that can better engage in all the social and economic activities that actually make this city a vibrant and good place, thriving place to live. And also in this section, you'll see a commentary which speaks to how a healthier population actually also happens to relieve pressure on the healthcare system. Here we have an opportunity as public health to influence the reorientation of the healthcare system so as to stem the tide, of acute care challenges by working upstream, right? That's really where public health fits, upstream, focusing on the population health level and the earliest stages of prevention. So that kind of thing, focusing on the earliest stages of prevention, means that we reflect on and work and influence other partners on important issues like housing, like income. These are fundamental preconditions for good health. So this is the kind of thing that we talk about within the introduction so that we are engaging constantly with you and with our broader public on what it is that public health is meant to do. So very, very clearly to the board, we are actually speaking about, when I speak about these conditions, when I speak about the value of public health, I'm actually talking about what public health ideally is or should be. What public health actually is, what is actually implemented, is determined by you, the decision makers, whether it's Board of Health at the local level, but also we have to think about what is happening at the provincial level, because of course, they are the ones that determine the Ontario Public Health Standards to which we are beholden, you as the board in particular, and as well when we think about the province, they are the majority funder for Toronto Public Health as local public health. So with that, now we're into the real elements of the plan. So next slide. Here are the first components, thinking about that pyramid, right? The first components, the vision and the mission. The vision, as you can see here, is a city where all people can be healthy and thrive, and this reflects important feedback that we heard throughout the development process for the need to emphasize people, right? Yes, it's about health, and of course, when we're talking about health, we're talking about people in this, when we talk about Toronto Public Health and what our focus is on. And then with respect to the mission, Toronto Public Health protects and improves health at a population level while reducing health inequities. This mission statement aims to reflect feedback about public health's role in health protection and reducing health inequities in all the work that we do. On the next slide, the values, which will serve as our guiding principles in all the work that we do. These build upon the previous principles as articulated in earlier iterations of our strategic plan and reflect the importance of Toronto Public Health being a credible and evidence-informed leader in the field, for us to be connected, and for us to be innovative in the work of public health. Next, we have the priorities. These 5 priorities will act as a blueprint to guide Toronto Public Health's efforts and complement the work that we're required to do as per the Ontario Public Health Standards. And so for the rest of this presentation, I'll walk you through each of the priorities and the corresponding objectives. Again, thinking through what the pyramid looks like. So priority 1, we have strengthen health protection, disease prevention, and emergency preparedness. So by way of recap on what you have heard us do in Toronto Public Health, every day we protect the health of Torontonians through core and fundamental interventions like ensuring the safety of drinking water and food. At the same time, we take the lessons learned from previous emergencies, including the COVID-19 pandemic, to prepare for the infectious diseases that we know will emerge in the future. We don't know which diseases they will be, but we know that there will be emerging infectious diseases. I've been here at the board on different issues, things that we've seen in the recent past, measles cases, mpox cases. These kinds of situations remind us of the pressing need for this kind of work. And we heard about the importance of this work through the engagement process, with infectious diseases being one of the topics that was regularly mentioned as we went out and about with our engagement process. Public health also, of course, has to prepare for other pressing public health issues like climate change. And in this context, a priority for Toronto Public Health is to strengthen health protection, disease prevention, and emergency preparedness through the objectives as articulated on the slide here in front of you. Preparing for and responding to outbreaks and public health emergencies, ensuring that we have enhanced emergency preparedness and response infrastructure, making sure that we effectively communicate with the public about how they can protect their health. This would include such activities such as social media campaigns, leveraging community partnerships to share messages broadly and to all of our community, developing clear and accessible online information so that the information does get out there and people are aware of what they can do to protect their health. And of course, the final objective is listed on the slide, is monitor and prepare for climate change and collaborate with partners to address the impacts of climate change. Turning to priority 2, this is focused on promoting health and well-being across the lifespan. Public health does work at all stages of the lifespan by helping to create healthy communities in which we can all live, learn, work, and play. This includes, of course, interventions to achieve optimal child health and development in the prenatal, postpartum, and early parenting period at the beginning of the lifespan, but it also includes those elements that enhance healthy aging for older adults. We heard through our engagement that promoting health through each of the phases of life is important to our community. So you will see we have this priority to promote health and well-being across the lifespan, and that the objectives under this priority, as are articulated on the slide, to reduce the burden of chronic and infectious diseases across the lifespan. So this kind of activity may include such things as advocating for policy change in the built environment, engaging schools to promote preventative behaviors, continuing the important case and contact tracing work that we deliver in respect of infectious disease prevention and control, and creating outbreak vaccination teams to respond to community outbreaks. Thinking at the other objectives, you'll see that we're talking about prioritizing effective interventions for children and youth to meet their changing needs, recognizing that the situation is constantly evolving in our community, to provide advice on aging in place and creating age-friendly communities, and of course to advocate for healthy social, natural, and built environments, and to collaborate with partners on initiatives that actually advance those goals. Turning to priority 3, this is around promoting the conditions to support positive mental health and to reduce the harms of substance use. We know, I'm sure you all know in your daily lives, both on a professional and a personal level, that many Torontonians experience mental health challenges. And we also heard throughout our consultation from many individuals the observation that mental health worsened during the COVID-19 pandemic. In a similar fashion, we know that substance use is common and can have significant impacts on overall health and well-being. We know that a public health approach to drugs aims to reduce harms, including such things as drug toxicity deaths and harms associated with alcohol, cannabis, and tobacco use. And we've heard through the engagement process that this is very important to residents of the city, and to the various stakeholders with whom we had the opportunity to speak. So you're not surprised, I'm sure, to see that a priority for Toronto Public Health is to promote the conditions that actually support positive mental health and to reduce the harms of substance use through a variety of objectives which are articulated on the slide in front of you. Delivering public health interventions that respond to the drug toxicity epidemic, reducing harms associated with the use of alcohol, cannabis, tobacco, and vapor products. This would include such things as public education, engaging with students and youth, enforcement of existing regulations, and advocacy for improved access to cessation and support programs. Making sure, of course, that whatever services are delivered are trauma-informed and ideally reduce stigma so that people do come forward and actually get the supports and assistance that they need. The final objective under this priority is to deliver public health interventions that promote mental health. Again, this is a part and parcel of protecting and promoting. And of course, we want to make sure that there are services available, certainly by us, but also by the broader healthcare system as well, that are certainly trauma-informed and that are stigma-reducing and supportive of people actually either restoring their health or staying in good health as best as possible. Priority 4, next slide, is to advocate to advance health equity. This was one of the key priorities that we heard through the engagement process. The desire to see Toronto Public Health's ongoing engagement in work to advance health equity to help address the needs of the population. We know that social factors such as gender, race, socioeconomic status, these kinds of factors are absolutely fundamental to the experience and the shaping of health. We know that health inequities really are created by unfair social policies and systems, and in fact, these are avoidable. So when we talk about achieving health equity, we are talking about the entire population actually having access to the resources and the opportunities that are needed to support their overall health and well-being. And we heard through the engagement process about how important it is for us as Toronto Public Health to continue work in this regard, and in particular to work with community partners to advocate for advancements in areas that actually impact population health. Hence the priority to advocate to advance health equity and specific objectives, including assessing and reporting on health inequities and population health needs, a fundamental piece if we are actually to be successful in terms of addressing health inequities. You also see objectives in respect of collaborating with partners across multiple sectors, recognizing that the factors that influence health are not just experienced within the health and healthcare system, but of course are throughout the conditions in which we live, therefore involving many other partners, often far outside of the health system. And finally, the last objective listed here on the slide has to do with sharing evidence, advocating and collaborating to influence actions that actually influence and impact population health. And final priority, priority 5, has to do with nurturing a positive workplace culture. We know that within the organization of Toronto Public Health, we must have a strong workforce in order for us to be impactful and effective in our work. Staff are at the core of Toronto Public Health. I can assure this board and members of the public that Toronto Public Health staff are dedicated, they're skilled, and they're committed to advancing public health in our city. Every single member of Toronto Public Health's workforce has a role to play in implementing the strategic plan. And as an organization, we're committed to investing in our people and enhancing our workplace. Hence, we have this priority in respect of nurturing a positive workplace and workplace culture with very specific objectives as articulated on the slide. Fostering a culture of innovation, continuous improvement, and learning is an absolute must if we are to continue to be able to serve the residents of the city well. Certainly ensuring that we have a skilled and diverse workforce is part and parcel of that. We wish to foster a welcoming and inclusive work environment, and we recognize, particularly given our recent experiences in COVID response, that the more we are able to facilitate collaboration across our entire organization, the more likely we are to be successful in terms of impact. So, final step, wrapping up the presentation, I promise, Mr. Chair, we're on to next steps. So we've walked through the strategic plan. Now we're on to the component where we can talk about next steps in terms of the successful launch of this plan, its implementation, and ultimately its monitoring, and how we plan to share with you, members of the board and the public, what our progress looks like over the next few years. So next slide, here are the specifics, or a little bit more by way of detail with respect to the next steps. So with your approval today, our plan then is to move into a phase where we start communicating with partners to share the launch of the 24 to 28 strategic plan and work towards next steps for collaboration and partnership to help us as an organization achieve the collective goals that I've articulated here in the presentation today. Following the launch of the plan, Toronto Public Health, the senior staff, will engage with staff to develop work plans in order to action the plan and identify outcomes both for short-term and longer-term measurements through operational work plans for monitoring and reporting. So through that, we actually use staff expertise in TPH program areas to help identify the specific tasks and performance indicators that will actually feed into each objective that allows us then to measure success over the life of the plan. And this we plan to use to, as performance indicators to help us report annual progress to you, the members of the Board of Health, and through you to our public. So with that, Chair, that is the end of the presentation. I will thank the board members for their attention, and I would just once again like to thank Vice Chair Bravo for chairing the Strategic Plan Development Committee and the other members of the committee as well for your leadership, for your collaboration. I am really very pleased at how much we've been able to achieve in a relatively short period of time. How much we were able to engage a broad range of audiences, and I hope that the board is satisfied with the process. I can tell you that certainly it was a very positive experience for us from where I sit. So thank you, Mr. Chair.
Thank you, Dr. Davila, for that very comprehensive presentation, and again, thank you to the Strategic Plan Committee. We do have several speakers on this item. First up is Randy Libman. Are you here? Okay, you have 5 minutes. I will be very strict on time today because we do have a lot of speakers on this item. Okay, we do have it. Go ahead.
You do have the slide?
We don't share slides, but we do have them. We share them with members of the board.
Okay. No problem.
We do have
Oh, I thought it would be displayed, but if it's shared, that's fine.
okay, you have 5 minutes. Go ahead.
Okay. Thank you for the opportunity to allow me to speak today. I'm here to talk about the health effects of sleep deprivation in relation to noise, specifically noise created by overnight waste collection. A quick Google search lists a multitude of negative effects of sleep deprivation, including cardiovascular damage, cognitive impairment, diabetes, endocrine problems, immune system issues, obesity, susceptibility to accidents such as motor vehicle accidents and slips and falls, mood disorders such as anxiety and depression, and the list goes on and on and on. I would describe the cause and effects of noise to sleep deprivation, but As you know, my time is limited, so please see my slide as well as my submission to the meeting today. About 2 to 3 years ago, the city allowed waste collection to occur overnight through an exemption to regular hours of quiet. You can imagine my surprise when the request for the exemption for overnight waste collection was cited as citizen safety. As previously noted, there are a multitude of negative health consequences due to sleep deprivation caused by loud trucks. So what kind of citizen safety could they be talking about? Not running people over or injuring people with their trucks? Sort of the same standards and accountability of every other vehicle on the road during the day and night? It didn't make sense to me. In my area, Yonge and Eglinton, there are 3 trucks nightly, approximately. One around midnight, one around 2 a.m. and 4 a.m. or 4 a.m., and one around 6:30 a.m. for waste collection. I am being woken up multiple times throughout the night, every night. Also, having multiple trucks is bad for the environment. Why not do the collection by one truck for the area instead of extra exhaust and pollution from additional trucks? Have it be one truck in the morning or one truck in the evening or one truck midday, basically any time except for overnight. My request of the Board of Health is to ensure the overnight exemption gets removed and these trucks do not operate overnight, causing negative health issues and blocking up our already overburdened healthcare system. To protect the quality of life and well-being of residents. Removing the overnight exemption will underscore and align with the strategic priorities of the Board of Health, including strengthen health protection, disease prevention, and protecting from negative climate change impacts, promote health and well-being across people's lifespans, promote conditions to support positive mental health. Thank you. If there are any questions, please let me know.
Thank you. Any questions for deputies? Seeing none, thank you for coming in.
Thank you so much.
Next up is Harold Smith. Are you here? Okay, you have 5 minutes.
Good morning, Mr. Chair, members of the Board of Health. My name's Harold Smith. I'm speaking as a member of the Lytton Park Residents Organization. To fulfill its strategic plan that Torontonians be healthy and thrive, Toronto Public Health must declare noise an epidemic and do the following. Have the medical officer of health report back to the board by early 2025 on the noise action plan updates to existing recommendations to address population level health concerns raised by residents in the noise bylaw review consultations. Warn that excessive noise endangers our health and well-being. Warn that gas-powered landscape and construction equipment noise and toxic fumes are serious health hazards, not a nuisance. To meet its priorities, public health must recommend battery power as preventative medicine to reduce noise and eliminate toxic fumes. This strengthens health protection, disease prevention, and emergency preparedness. Warn that gas-powered lawn and construction equipment produces dangerous noise, carcinogenic emissions, and smog. Many landscape and construction workers are recent immigrants. English isn't their first language. They're exposed to noise and emissions while grooming landscapes or doing construction in Toronto's wealthier neighborhoods. Talk about equity, social equity. Urging industry and residents to use battery power advances worker health and safety and promotes health and well-being across the landscape. And I would say it nurtures a positive workplace culture. The California Air Resources Board warns that a commercial leaf blower operating for an hour emits smog-forming pollution comparable to driving a light-duty passenger car about 1,100 miles or 1,700, almost 1,800 kilometers. Public health must warn about these dangers and tell City Hall to ban gas-powered equipment to help prepare for climate change impacts. Scientific American's article, Quiet, Our Loud World is Making Us Sick, cites Dr. Jamie Banks of Quiet Communities, who was working from home and found the horrible noise from industrial leaf blowers, lawnmowers, and hedge trimmers occurred hours daily, and gas-powered leaf blower noise outside exceeded the WHO's cutoff over a 24-hour period to protect hearing. She found this harmful for her, workers operating the equipment, and people nearby, including children and seniors. She noted that noise stresses the circulatory system, including the heart and blood vessels. Epidemiological studies have linked environmental noise to high blood pressure, heart failure, myocardial infarction, and strokes. To make Toronto healthier and meet its priorities, Toronto Health must declare noise an epidemic, improve its messaging regarding the harmful health effects of noise. Toronto Public Health commands the media's attention with easy access to print, broadcast, and social media. And by the way, I checked X. The last time Public Health posted about noise was in 2017. So I think there's a room for improvement in this field. Recommend safe noise levels for the noise bylaw by the first quarter of 2025 deadline, and warn about gas-powered equipment noise and pollution hazards and their health inequities. And lastly, to quote the Lancet's recent article, Noise Pollution, More Attention is Needed, it quoted 1910 Nobel Prize winner Robert Koch predicting that, quote, "One day man will have to fight noise as fiercely as cholera and pest," quote. It is time that the social environmental implications of noise pollution and its effect on public health receives more attention and becomes a priority before it becomes a planetary epidemic. Thank you very much.
Thank you. Any questions for the deputy? Seeing none, thank you for coming in. Next up is Deanna Scriver. You have 5 minutes.
Morning. I'm here today to ask that noise be prioritized as a major health hazard. It affects the nervous system negatively, can lead to anxiety and stress, heart problems, substance abuse, and other health issues. I support everyone who is here with their noise issue and represent others who could not be here today. There needs to be a noise reporting system that works, and it should be taken seriously. I am exhausted today from not sleeping. The garbage truck came at 3, and when they dropped the bin, it jolted me awake and I could not get back to sleep. I've said this before. This has been going on long enough, 3 times a week, twice a night. My health would be so much better if I could sleep. This is one example of damaging noise. There are many studies to show how damaging noise can be to people's health. If you have ever experienced a sleepless night due to noise, you can see what we mean. For some in this city, it is a constant stressor. Please make noise a priority in this strategic plan so that the residents of Toronto can be healthy and contributing citizens and not just stressed out, exhausted, and merely existing. Thank you so much. That's all I gotta say.
Thank you. Any questions, Deputy? Seeing none, thank you. Kathleen Payne, are you here? Go ahead.
Hello, Toronto Board of Health. I'd like to start by saying I really appreciate your work. And like many, I became more aware of it over COVID. More recently, I really enjoyed reading your website where you explain what you do by saying a doctor usually treats one patient at a time, but that your patient is the entire population of Toronto. Noise pollution is a health problem that affects the entire population of Toronto. All ages, all neighborhoods, although just like many other health issues, there is significant inequality in its impact. Yet because there is no defense against noise pollution, sound being a completely undefended border, it is not necessarily income that determines the degree to which people are affected. If you live in a lovely, expensive condo, but it's on an arterial road, you will be affected. Whether they know it or not, all Torontonians are impacted by noise pollution, which contributes to cardiovascular problems, mental health, blood pressure issues, and several other stress-related illnesses. We also know that many who are sight impaired need their hearing to navigate safely, and that for the neurodivergent, noise creates further barriers. Well, good news. There is a tool you can add to your little black medical bag, noise reduction. You already advocate for clean air and green space as a health benefit, and now it's time to seriously consider adding noise reduction to your toolbox. Earlier responses to this problem from our leaders were often along the lines of, you get used to sound and noise means the economy is booming. Well, we now know that simply is not true. What is true is that a reduction of noise equals a reduction of healthcare costs. So it is now time for bold leadership and courage about this problem. More good news is that in some ways this issue is a bit of a no-brainer compared to finding a cure for cancer. Huge advances in noise pollution reduction are nowhere near as difficult to achieve. You could advocate for establishing a noise commissioner, or you could launch an educational campaign for the general public, raising awareness that the soundscape is a shared space. And I'm not suggesting a paragraph about noise buried on page 12 of your excellent website. I'm suggesting something much more. Because we all own the soundscape in Toronto, no commercial activity, business, or individual with a modified muffler should be allowed to dominate it. You could advocate for enforcement of existing rules about this and push for stronger ones. I moved to Toronto in 1982, at a time when tobacco control was very much needed. Soon after arriving, I joined a lobbying group called Non-Smokers' Rights. This group became one of the most successful lobbying groups in the world, winning many awards for its advocacy. The reason for that success was a combination of outstanding leadership, timing, and an educational campaign that showed people how dangerous smoking was, even for those who didn't smoke. The vast majority of people in Toronto are kind and considerate citizens who, if informed about noise pollution and how harmful it is, would eventually respond in the same way. The time for Toronto to pipe down is now. But far be it from me to tell you how to do it. You are the health professionals, but please do something. The TTC has already begun with their silent commute signs about speakerphone use and promoting the wearing of headphones for music. You guys at Toronto Board of Health are kind of rock stars now after COVID, so use your platform to get on TV and get on all the media about this issue. Toronto needs you to speak up and spread the word about the health dangers of noise pollution at an acceptable volume level, of course.
Thank you. I do have a question for you.
Sorry, please. I'm trying to get off before the 5 minutes.
Yes. Are you aware that in Q1 of 2025, there's a noise action plan coming here to the Board of Health?
Yes, I did read it.
Okay.
I did see it, it was on your website, right?
It's coming to Q1.
Oh, I'm sorry, then maybe I'm not fully aware.
But it is on the website, I believe.
Oh, that's good news.
And we also have a report coming to ECDC in Q1 of 2025 as well from MLS. So just so that you're aware, there are things happening, and it's coming.
I'm so encouraged to hear that. That's just great news. I walked here from the subway, and through the construction, I literally had to walk 2 blocks like this. I felt embarrassed, as you know what. I thought everybody would think I'm a mad woman. But the construction on Queen Street is way over any acceptable level, so.
Thank you. Sue DeGrantis? You have 5 minutes?
My name is Sue DeGrandis, and I live near Christie Pitts Park. I'm a member of No Noise Toronto. What is noise? Noise is unwanted sounds. Noise pollution is not a nuisance, it's a public health hazard and a destroyer of my human entitlement to live with equanimity in an emotional and physical sense. I live in the city of Toronto, yet my body feels like I live in a war zone. I walk along the streets of Toronto, or I try to sleep at night. I am constantly subjected to noise, unwanted sounds. I do my best to protect my hearing, but unfortunately, I cannot protect my body, how it reacts to these sounds. I am subjected to loud rave concerts that take place in Christie Pitts Park. Operated by a for-profit group, they continually operate for 8 hours continuously. Wearing earplugs is not a solution. I cannot sleep, and I get murderous thoughts. Then there are the fireworks that are indiscriminately lit throughout the days leading up to specific holidays and for several days afterwards. July 1st just passed. 3 fireworks were thrown into my backyard about 2 o'clock in the morning. Then the deafening noise, the Blue Angels airplanes that fly over our house in late August. I always planned to be out of the city in those days. It drives me crazy. My dogs have to run and hide, and the cats are beside themselves. We have the constant vanity noise in this city of ego noise from altered vehicles equipped with flowmasters to circumvent the factory install and the environmental protection laws. These vehicles are often driven by young male drivers who are seeking attention. Next is the 24/7 emergency vehicles that screech along our roads, regardless of the day or night. When there is zero traffic on the road, these sounds travel for miles. In Europe, they use a much different system that is less invasive, travels less further away, and is at a different frequency. They consider people over vehicles. I am entitled to live in the city, but it is a city of constant noise. But it doesn't have to be that way. We could be living a healthy life that was full and enjoyable, but that is not the case. The noise in this city drives me crazy. I choose to live a mindful life. I'm careful with my health, but I can do nothing about this noise. It takes away my enjoyment to live in the city, and why should I have to run away on long weekends and holidays just to get away from noise? What happens to my body is this: my heart races, my head pounds, my ears hurt. I have gastrointestinal problems, and my gastroenterologist says that my intestines are healthy. Magically, when I leave the city, that problem goes away. My husband suffers from headaches and high blood pressure. Again, magically, when we go away, he seldom needs his medication. This city is not a healthy place to live. Noises like this are not just a nuisance, they are a public health hazard. I would like to see the City of Toronto appoint an office for noise. I would also like to see the city invest in noise cameras throughout our city with meaningful deterrent fines, with each subsequent infraction doubled. This is operating throughout cities in Europe, and New York City has been very successful with this noise camera program, and it has paid for itself in a very short time. I would also like to see a congestion tax applied to vehicles that come into our city. For non-residents, they come into our city deliberately to make noise with their altered vehicles.
Okay, 5 seconds.
I hope this committee will take the noise issue as a serious public health matter. Thank you for listening.
Thank you. Any other questions? Seeing none, thank you so much. Adam Cajon, do you hear? Is Adam here? Okay, we don't see Adam online or in the room. Angus McCall, online. Angus? Okay. You're on mute. We still can't hear you. Angus, we cannot hear you.
Hi, thanks. Can you
There we
hear me
go.
now?
Yes, we can. You have 5 minutes. Go ahead.
Apologies. Thanks so much. Thanks to the board for hearing my deputation today. I'd like to speak quickly to how I believe advocating for noise reduction in the city fits into Priority 1 Objective D, monitor and prepare for climate change and collaborate with partners to address its impacts. I live with my family in Bay Clover Hill. We can't sleep with the windows open because of the noise in the neighborhood from traffic, generators, construction, sirens, and delivery trucks. It's also difficult to work from home during the day for the same reasons. And neighbors have talked with us about the same issues. As Toronto experiences more heat waves, the population experiences negative health impacts from heat exposure, ranging from an inability to focus to heat-related deaths. Heat and sound are both forms of kinetic energy. I believe that the Board of Health can address Priority 1 Objective D at the earliest stages of prevention for heat exposure by advocating for lower traffic speed limits, sound mitigation on construction sites, lower siren volumes, and reduce delivery truck hours. This would allow families like mine to keep ourselves cool during heat waves by opening the windows when we need to. Thanks so much. That's all for me.
Thank you. Short and sweet. Any questions? Seeing none, thank you for coming in today, Adam. Angus, actually. Joseph Fox, are you here? Okay, Joseph, you're online.
Yes, I'm here.
Okay, we could hear you. 5 minutes, go ahead.
Great. Thank you so much. Good morning. My name is Joseph Fox. I'm a professional engineer in the heating, ventilation, and air conditioning field. I'm the chair of the Indoor Air Quality Advisory Group for the Ontario Society of Professional Engineers, and I'm here representing them. We believe indoor air quality should be one of the major themes for Toronto Public Health Strategic Plan. In this regard, I'd like to speak about 3 of the priorities of Toronto Public Health and how they apply to indoor air quality. The first priority is disease prevention. We have seen over the COVID-19 pandemic the role that buildings play in disease spread. It may be surprising to know, but our buildings are not designed to prevent disease transmission. The ventilation required is solely about mitigating poor smells and known pollutants like formaldehyde, but does not account for intermittent pollutants like pathogens. To mitigate respiratory viruses, we need a proper standard applied to buildings to ensure occupants are protected. We now have that standard. It's called ASHRAE 241, Control of Infectious Aerosols. It provides appropriate air cleaning rates to reduce the risk of airborne disease transmission. It's not complicated, it's cost efficient, and it's one of the most effective tools to prevent infectious disease transmission. Dr. Ashish Jha, the former White House COVID-19 Task Force Coordinator, stated that this is one of the most important public health interventions since we started ensuring people have access to clean water. Public health has an important role in promoting methods to reduce the risk of disease spread. Furthermore, many organizations like school boards have followed Toronto Public Health's advice. When it comes to using ventilation and other air cleaning tools to mitigate the risk of airborne disease spread, including COVID-19, our opinion is the advice should be that buildings comply with ASHRAE 241, control of infectious aerosols. Giving general advice about opening windows and checking to make sure ventilation is working has been insufficient. All buildings need to provide a reasonably low-risk environment, and ASHRAE 241 is the answer to that. This will also help pandemic-proof our buildings. I'd like next to speak about the second priority, promoting well-being, and the fourth priority, equitable access. We ensure that people are provided with clean water. We don't just wait to see if 20% of people are dissatisfied with the taste and otherwise assume it's fine. We do not tolerate pathogens in the water that are making people sick. We also have methods to ensure that people are provided with safe food. Places are required to undergo inspections, but we have no system like this for air. The correct solution would be to test the air for pollutants and take corrective action if the pollutants are too high. Important pollutants like formaldehyde and fine particulate matter, and especially carbon dioxide, should be monitored in spaces. As a personal story, my child's daycare's ventilation was broken. The place smelled awful. I tested the carbon dioxide myself, and it was in excess of 2,000 parts per million. After notifying the staff, they simply told me that the landlord refused to do anything and there was nothing they could do. There were public health inspectors in there very often to check the food, but all they needed to do was carry a carbon dioxide monitor to know that something was wrong, but that wasn't happening, and there was nothing that could be done to fix the problem. High carbon dioxide levels indicate that the ventilation systems are not functioning properly or not in compliance with indoor air quality standards. Fine particulate matter is an extremely harmful pollutant, as we have seen from the wildfire smoke, but without testing the air, we have no idea if the air is clean or harmful. This is how clean air can be regulated and ensure all people have access to clean the air. Test pollutants in the air and then take action to reduce those pollutants if they're too high. Toronto Public Health can also take meaningful steps on this by providing education and guidance around testing the air. They can also promote this by performing testing in their own buildings and publishing the results. This will also help mitigate wildfire smoke. Improving filters and HVAC equipment that are effective against fine particulate matter is a simple step to take and will have a massive effect in reducing people's exposure to outdoor air pollution and wildfire smoke. Our current filters are not effective against fine particulate matter, but with a low-cost improvement, it is not difficult to ensure that they are effective and protect the occupants. Without testing the air, we would never know. This is also important from an equity perspective, as historically marginalized groups, including Indigenous communities, often have exposure to poor indoor air quality with very harmful effects on their health. In summary, there are two important steps that Toronto Public Health can take as part of a plan to reduce disease spread, promote well-being, and advance health equity. The first would be recommendations and guidance about implementing ASHRAE 241 control of infectious aerosols, the standard to reduce the risk of airborne disease spread. The second would be to promote air quality monitoring, provide guidance about what pollutants to test for and what concentrations they should be, and take corrective actions. Thank you.
Thank you, Joseph. Any questions from deputants? Seeing none, thank you so much. Mark Hall, are you here? Online? Mark?
Hello, can you hear me?
Yep, you have 5 minutes, go ahead.
Thank you so much. Good morning and thank you. It has been said that health is wealth, and since Toronto is one of the wealthiest cities in the world, it only makes sense that it should be one of the healthiest. I believe that noise pollution is a serious threat to our health, and I'm here to push for it to be part of the 4-year agenda. Noise-related objectives can be tied directly to at least 3 of the priorities emerging for Toronto Health, such as health protection and promoting health across the lifespan. Hearing protection, the ability to sleep and to be safe from constant noise interruptions are not luxuries. And we must also think about those more vulnerable in our society, such as the elderly, young children, people with visual impairments, head injuries, etc. Promoting conditions that support positive mental health. Noise has been shown to cause anxiety, stress, and which can lead to depression and high blood pressure. Advocating to advance health equity. Noise is certainly an equity issue. income determines where one can live and if one can get away from the city and if one can insulate themselves from noise. And we cannot forget about those who sleep during the day because they work at night, such as police, doctors, and firefighters. Deliberately modified cars, garbage dumpster pickup at 2 a.m., and our old friends, the leaf blowers, are part of my regular experience and surely must have an impact on my health. The health impacts include sleep loss, hearing, stress, and constant irritation. With the massive population growth that Toronto will see over the next decade, it is only logical that a lot of noise will come along with it as well. It will need to be a priority at some point, so we just as well should make it a priority today instead of finding ourselves behind the curve 4 to 8 years from now. Thank you and for your time and consideration.
Okay, thank you. Mark, any questions for the applicant? Seeing none, thank you, Mark. Linda Poirier, are you here? Online? Linda? Unmute yourself, Linda.
Okay, and I'd like to share a screen if I'm able. Share my window.
We can do that. Okay, go ahead. You have 5 minutes.
Great. Can you see my presentation?
Not yet.
Share. Here we go. Share. Thank you. So I'd like to thank the committee for all your work in developing a comprehensive plan. I'm here to reinforce the critical need for the work plans that action the strategic plan to include concrete measures to reduce environmental noise pollution. And I'm here speaking on behalf of YCCA, the Young Corridor Condominium Association, which is a resource for directors along the Young Corridor to network and implement best practices. I'm here to raise concerns on behalf of thousands of condo dwellers in the area with governments to improve the safety and quality of life in our community. The Young Corridor is vibrant, dynamic, convenient place to live. There's lots of employment, shopping, restaurants, and transit. And we recognize that cities are by nature noisy, but there is a problem with revving and racing and modified vehicles. It's a significant issue in our corridor. It's prevalent in summer. It often takes place during the night and interferes with sleep. Sound bounces off our tall buildings, and we're seeing increasing evidence of negative health effects on exposure to high noise levels. Irresponsible drivers also present pedestrian safety concerns, so we're here to speak to that issue. We encourage the Toronto Board of Health strategic plan to include steps to reduce environmental noise pollution and establish guidelines for daytime and nighttime noise level maximums to promote better mental health and well-being across lifespan. We want you to address health inequity by working to reduce nighttime noise so people living in buildings without air conditioning can have their windows open and cool their bedrooms with fresh air. We encourage you to prioritize steps to reduce noise levels, particularly at night, to prevent the excessive use of sleeping aids and other drugs to function the next day. This is important to reduce the harms of substance abuse and to support mental health. And we encourage you to work with other city departments and levels of government to understand the harms created by excess noise and recommend solutions. We're not here to provide solutions, we're here to just highlight the problems. And I was encouraged to hear just a little earlier that there is a noise action plan to be implemented in Q1 2025. That is such a positive step, and we really encourage that to continue. I'd just like to end with a few testimonials because so many people have contacted YCCA to talk about this issue. Chronic pain makes sleep important. Speedways of souped up cars make it difficult even with windows closed to sleep. Loud vehicles impact mental health. People complaining the right to peaceful living is in jeopardy with high levels of noise causing health implications. Noise wakes people up several times a night. They can't get a good night's sleep. Protester noise is also an issue. Loud cars and protesters cause great disturbance to peace and quiet in our neighborhood. People who can't open windows at night because of noise are sleeping in heat. Seniors with limited mobility are having issues just getting across the street with hurried vehicles, cars racing on the street. Noise from protesters' loudspeakers are causing harm. And the constant thrum of traffic that is broken intermittently by revving engines, fire trucks, ambulances, noise of construction. We heard about garbage pickup. These are all disturbances that need to be addressed. Sleep deprivation is a health issue in our neighborhood. So I'd like to thank you for allowing me to speak on behalf of residents in the Yonge Corridor, and thank you for your time.
Thank you. Any questions for Deputy? Seeing none, thank you, Linda. Next up, Anita Germer, are you here? Anita Germer? Okay, you're online. Please unmute yourself.
It won't allow me to unmute.
Yeah, we could hear you now. You have 5 minutes. Go ahead.
Thank you. I would like to speak today about an event that took place on May 27th, 2020. That's the day that Regis Korchinski-Paquette fell to her death from the balcony of a Toronto high-rise apartment where she lived with her mother. Regis's brother had recently moved into the two-bedroom apartment with his children. And on that day, Regis had repeatedly asked him to turn down the TV, but he had refused. Arguing escalated to physical violence, and all three parties called 911. 6 officers responded, interviewed the parties separately, and then allowed Regis to go back into the apartment to use the bathroom.
Excuse me.
Yes.
Chair, I just want to ask that we not reference an incident where a person fell to her death in circumstances which had to be investigated as in relation to this item. This is related to the Board of Health Strategic Plan. And one of the things that is clear from our work here is that we have to be caring of each other. And this, to me, Chair, is offensive, and I don't think it should be allowed to continue. I'm sorry, ma'am, as a deputy, and I know through the chair, it's just, let's not use a tragedy like this to make a point about something that may or may not be related and for which we have no evidence.
And I agree with Councilor Bravo. So speak to the item at hand, not to individuals.
Well, I'm sorry, I'm not prepared for that because I wish to show how noise can create tragedy in a specific event and how it costs us when we have events like this.
No, this is not related to the item at hand, and
okay.
You have
Thank you then.
Okay, thank you. John Day, are you here? Yeah, you have 5 minutes to depute.
Chairman Moyes, members of the committee, thank you for the opportunity to address you. My name is John Day. I've lived in Ward 4 for over 10 years. I have for you a brief reflection on noise, public spaces, public health, and a path forwards as it relates to TPH priority number 2, the promotion of public health and well-being across the lifespan, in about 2 minutes, 45 seconds. Public spaces are critically important in a city, and they have been ever since cities started to exist. They define many things about a city, and when we talk about public spaces, people tend to think about Hyde Park and Nathan Phillips Square and places like that, but the more important public spaces are incidental places in the city. They're little kind of made-up areas where people can collect, where there's a little bit of shade, a place to sit, and a sense of safety. And these are important to public health because they promote positive social contacts, they allow people to group together, increase physical activity, and a sense of community or belonging. Good public spaces have to be accessible to everybody and have to be accessible in all parts of the city, close to people's work, close to where they shop, close to where they live. The critical components of a public space really are shade, a place to sit, and a sense of safety. Unfortunately, many of these public spaces in our city are threatened by noise, particularly vehicular noise, because these places often are created in places close to roadways. And the roadways and the excessive noise basically damages the ability of those places to be used by people. Our better presentation might include a whole bunch of photographs from my neighborhood of places that should be public spaces that aren't being used just because they're too close to roadways and the level of noise is excessive. There are two types of noise that we should be thinking about. One is the ambient level of noise, often known as LEQ, which is very high along our roadways. The second is the peak noise events, which are caused by modified mufflers and illegally modified cars. If you don't believe what I say, there's a very simple test, and that's to go down to Simcoe and Front Street and walk north along Simcoe towards King Street, where the traffic is calmed. And very quickly, you'll see that you can start to hear birds, you can hear people talking in the areas around you, and the level of the LEQ has dropped significantly enough that you can relax and you can hear human sounds around you, where you don't get that in most parts of the city. There are two very simple tasks, I think, that would help address this problem. The first is to advocate for target noise levels for day and night as a base for the City of Toronto. And the second is to commit to programs of monitoring noise levels 24/7 for months at a time across the city. Once we know the noise levels, we'll be able to deal with it effectively. Thank you very much for your time.
Thank you. Any questions with Deputant? Seeing none, thank you so much. And you're on time too. Eric Weiner, are you here? Online? Can you hear me?
Can you hear me?
Yes, we can. You have 5 minutes. Go ahead.
Oh, okay, but you can't see me though. Oh well, whatever. Just pretend you could see me. Okay. So to the Board of Health, my name is Eric Weiner, and as has been noted within the city in previous campaigns, mental health is health. We've had some campaigns over the years indicating how important mental health is for overall well-being and functionality. I couldn't agree more. However, loud and excessive noise wears on you and gradually causes long-lasting harm and severely impacts one's mental health. When it's too loud to sleep, insomnia results. This is a serious medical condition that results in serious mental and physical health problems, providing increasing burdens to our healthcare system. Toronto is already burdened enough as is, and there are ways to mitigate this encumberment. All we need is some tougher laws and proper enforcement of those laws. I acknowledge that noise will always be a fact of life, especially in a bustling city like Toronto. I'm not an unreasonable person. I want what benefits us, all of us in the long term. I want noise to be properly manageable and easily enforced when there are problems. When cars are revved up to backfire, and construction projects go beyond regular hours, when dogs are unattended by neglectful owners and they bark constantly or even sporadically but loudly, there needs to be an easy way to get authorities to enforce laws. Gentle suggestions will not help in this matter. I know this from experience. People only change their behaviors when there are real stakes involved. This too is a fact of life. What do I propose? Work on improving the city's infrastructure so that noise is reduced. I do not know if having more bylaw officers is within the health board's mandate. I do know that having the resources for proper enforcement will make a big difference in the quality of life for all Torontonians, and it will definitely improve our health. And this can still be done without improving the social health of the Torontonians. Health issues like this are interconnected in Toronto. The issue of noise and the desire for more quiet is, believe it or not, related to people with substance abuse problems. Like Toronto Needle Exchange programs or any program that advocates for harm reduction is a noble goal, but people stressed by noise may turn to substances, or alternatively, if they already are dependent upon illicit substances, may find it even harder to quit if that is their desire to do so. Arguably, a healthier Toronto also includes Torontonians that are less dependent on illicit substances, or at least feel they have the support they need to quote unquote get clean. I don't know why I said quote unquote. I know that this is a complicated issue, and I bear no judgment or any ill will to anyone that has an addiction. I'm simply suggesting, or I mean, outright stating that noise pollution has a contributing factor to substance misuse and abuse. The quality of life of those that do not have the fortune of having shelter, in other words, the homeless, is also correlated with noise pollution. I have seen suggested by others that the stress of excess noise, as well as the sleep deprivation that can occur even amongst those without shelter as a result of so much noise, results in riskier behavior among some members of the homeless. And that to me makes perfect sense. It's hard to exhibit good judgment when sleep deprived or stressed from noise that just doesn't stop. By addressing our city's noise problem and working hard to find solutions, you're helping so many more people, even if other issues don't seem to be directly correlated. Speaking of shelter, I began the process of looking for a new place to move. I barely have the resources to move as is, and many other people are far less fortunate and don't even have the luxury of even considering moving. This alone is most definitely a health equity issue. Exorbitant moving costs, especially welcome taxes that are tens of thousands of dollars, discourages moving even amongst Torontonians themselves. Okay, running out of time here. Yeah, this is very unfair and unequitable. I call this being trapped in a noise prison. It sounds hyper because you can't move. I've called dispatch officers when I complain about noise and they say move, but you can't move. It sounds hyperbolic, but this doesn't make it any less true. So our city's housing crisis is also related to our noise crisis. I also agree with so many others, whether we're talking about the garbage trucks in the middle of the night. That's a very real issue. No one could sleep when garbage comes at 2 a.m. and that disrupts sleep, and that decreased productivity, increased mental health problems, and leading to substance abuse problems or making it harder to quit. So I yield the rest of my time, but I think you get the gist of what I'm saying.
Thank you. Any questions for the applicant? Seeing none, thank you. Eric. Mariko Ude, are you here? Okay, you have 5 minutes.
Dear Board of Health, the pandemic and how it was managed has taken an enormous toll on our physical, mental, economic, educational, and social health. As such, reflection on it, I would have expected would have had a major role in shaping the strategic plan for the next 4 years. As part of the consultation process, I helped make 3 community conversations happen involving 40+ individuals. Many important points came up, which you can find in my letter submissions. The top 3 things that I think should be in the strategic plan are: 1, we need to help those that are vaccine injured. We need Toronto to acknowledge the extent of vaccine harms and be a leader, a world leader in research, diagnosis, and treatment. Number 2, some pandemic policies cause loss of employment and schooling, social division, isolation, and inactivity. We need Toronto to refrain from policies that, in the name of health, erode the social determinants of health. And number 3, there are other ways of dealing with infectious diseases than big pharma, vaccines, and WHO recommendations. Toronto can be a leader in exploring other perspectives before the next pandemic. And now for something entirely different. For the second part of my deputation, I'd like to read a poem or a prayer that I prepared in response to the strategic plan consultation question: what do you imagine Toronto will look like when we succeed in our vision? I hope you'll all enjoy it. A healthy city for all. In this city of 3 million unique souls, may we have clean air and clean water, and each of us a place to call home. May we have gardens on roofs, balconies and ground, fresh farmers markets and nourishment abound. May parks be free of litter, full of picnics and song, main streets bustling with bodies bumping along. May there be builders and bankers, beauticians and boxers, work of all kinds from beekeepers to ballet dancers. May traffic flow smoothly and cross my fingers safely. Trucks grooving, buses humming, cars zooming, bikes breezing. May our city be filled with beauty and heart, from architectural triumphs to sidewalk chalk art. May our public square be boisterous with passionate opinions that with debate and discussion yield unthought of solutions. May the church bells ring glory and the temple's sweet silence. May each soul be nourished, strengthened, and encouraged. May our medical treasure chest be rich with healing of all kinds, drawn from all the diverse cultures to help humankind. May the suffering get help and be treated with care, listened to, understood, with abundance to spare. May shadows that lurk be brought to awareness and transformed like compost to wellness and good humus. When challenges come, as they most certainly do, may we never be divided or told what to do. May we be empowered and awakened and go deep in our souls to dig out the gifts each of us hold. Big pharma, big tech, big ag, less listening to corporations or the WHO. Big pharma, big tech, big ag have to go. No more division, no more isolation, no more censorship or fear. These strange concepts are from elsewhere. We must resist them, hold each other near. May our science be transparent, humble, and honest, comfortable with uncertainty, and always curious. May our newspapers be truthful, our protests furious and free, powerful but peaceful, inspiring to see. May the lonely find each other, friends and kind strangers, and may families flourish like our favorite dandelions. May kids have adventures and seniors joyful moments, and may they often cross paths and learn from each other. With summer come fun, flamboyance and flair, may all stripes of the rainbow enjoy life without fear. May each in this city of 3 million souls sleep soundly and eagerly await each blessed morrow.
Good. Thank you.
Thank you.
Any questions for the deputants? Seeing none, thank you. Ingrid Boudet, you have 5 minutes.
I have a presentation, as usual. Sorry. There.
Okay, time started. Go ahead.
Time started. Should be able to see my presentation. There we are. All right. Well, Chair Moyes, Medical Officer of Health, Dr. Davila, counselors, staff, thank you so much for the opportunity to share my thoughts with you today on the Toronto Public Health Strategic Plan. My name is Ingrid Boudet. I'm the founder of No More Noise Toronto. We're a grassroots organization of over 1,300 individuals, 800 followers on social media, and we started at the right time. We started before the noise bylaw review with the public consultations. We had a strong presence there, and I'm so thankful to be available and to have a group that's ready to speak with you here today on the 4-year strategic priorities. You've heard the stories over the course of this process. Thousands of emails, hundreds of deputations, over 100 deputations. There's a lot of support out there. Many people are suffering. They're suffering mentally, physically. Relationships are broken. People are feeling they have to move. They don't like living in the city anymore. And who are those people? We are your patients. And as you said in that document, in public health, our patient is the entire population of the city of Toronto. So we need you to protect us from noise. Workers have protection from noise through their employers. So who protects us? Who protects the non-worker and the resident? You do. So I'm going to speak to you today about priority number 4, advocate to advance health equity. Point A, assess and report on health inequities and population health needs. B, collaborate with partners across multiple sectors to address local health needs. Well, if you want to assess and report on health equities, you need data, and we've got lots of it. Through my sound level meters, we've got over 50,000 hours of data. Councillor Sachs has also bought a sound level meter, and I've measured from over 75 different locations in the city of Toronto. We also have a crowdsourced ability to collect data. The No More Noise community is engaged, Municipal Licensing and Standard asked us to help with the muffler inspection and location sites, and we had over 800 responses in 2 weeks. And below is an example of the noise century measurements that we have. The other thing that you need to do, the other option that is available to you is track it. And this is built by Civic Tech Toronto. This is an accurate sound level meter for around $50. It was designed and built by a volunteer organization right here with thousands of hours of volunteer effort. This is how much noise means to people. And this data will be publicly sourced and available on public dashboards. So this is also available to you. And B, collaborate with partners. Here we are. No More Noise Toronto is right here to collaborate with you. We are working with Municipal Licensing and Standards, Customer Experience Division, Toronto Police Services, and are ready to collaborate with you. Your patients need you to take action. We want to help Toronto be leaders in understanding and reducing noise pollution. So recommendations, work with No More Noise Toronto and Civic Tech Toronto to collect data. Include reducing noise pollution in your operational work plans. Dust off that noise action plan from 2019, and thank you to Councillor Bravo for that motion to bring that noise action plan forward. Redo the 2016 sound level mapping. That was part of a number of studies, and in the study of how loud is too loud. City's gotten louder since 2016, and I would love to be able to remap that and understand the difference between then and now. Lastly, educate the public on impacts of noise pollution and how to be a better neighbor. I just saw today on X, there was a post about amplified sound and being a good neighbor. Thank you. That was from the City of Toronto. We need more of that. And maybe, just maybe, have one day of no noise. And let's just see what the city would sound like. Would we hear birds? Would we hear more people having conversations? Could we sleep with the window open? So final thought. Noise is a global problem that no one, no person, no animal, no organism has a defense against. It is the first sound we hear, and it is the last sound we hear as well. So you have a great opportunity to build on a foundation already laid and to improve our health and well-being. So let's create a better Toronto by reducing noise. Thank you.
Yeah, thank you.
Thank you.
Any questions for the Deputy? Seeing none, thank you, Ingrid.
Thank you.
Heather Pun, are you here? Online? You have 5 minutes, Heather.
Hello, can you hear me?
You can. Go ahead. You have 5 minutes.
Thank you. Thank you for giving me the opportunity to speak to you today. As a concerned parent, I'm happy to see that the strategic plan for the next 4 years has a clear vision and mission where the health of Torontonians is centered. The vision, a city where all people can be healthy and thrive, is imperative, but I think one that has been cast aside lately. We are not preventing disease, and we are increasingly making our population unhealthy by allowing the spread of preventable disease to go unmitigated. We see this all over our city, but I personally see it specifically in our schools. Schools which no longer are required to report COVID cases, but are still required to report lice. Schools where we aren't educating our future leaders on the benefits of mitigation, clean air, and protecting each other. For 9 months, I argued with my school for cleaner air for my child's classroom where CO2 levels regularly reached above 3,000 ppm. For 9 months, the TDSB has refused to give me any indication of what measurements they obtained, and they also have refused to provide any regulation around what levels of CO2 is acceptable. More than 300,000 public school students and over 50,000 staff spend their days in poorly ventilated classrooms with little mitigation and no standards. This amounts to 12% of the population of Toronto. These staff and students have families that they go home to, and so the spread of these diseases is much further reaching. City of Toronto employees benefit from indoor air quality guidelines of less than 1,000 ppm CO2, but schools are experiencing 3 times this level, and parents are unable to do anything about it. Public schools defer to public health, so I urge public health to make this a priority. All of us breathe indoor air. Clean indoor air can impact the health of everyone in the city. It can reduce disease, which in turn reduces chronic illnesses and reduces the pressure on our healthcare system. This aligns with the mission of TPH, where public health protects and improves health at a population level while reducing health inequities, and priority 2, objective A, B, and D, as well as priority 3, objective D. Not everyone works for the City of Toronto, so air quality standards should be citywide and not just reserved for those in office buildings. Air quality standards will also align with issues surrounding wildfire smoke. Our children have many more years of living to do. Let's allow them to do their earliest ones safely. In the push to get children back to school, both TPH and Sick Kids, along with others, developed a back to school plan that involved masking, testing, isolation, staying home while sick, and reporting of positive COVID tests. Gradually, all of those mitigations have left, and the schools are full of coughing, sick children who are at school because TPH and others have said that in-person school was most beneficial. I wonder if at the time of that statement, anyone could have foreseen that we would still be dealing with large waves of COVID and other infectious diseases, but with no mitigation. Most think COVID is over. Most do not know or realize that it is still a very real threat. The threat of ongoing complications and downstream effects is still very much present. Long COVID is a real threat. While TPH has all of this on their website, no one seems to know. As part of your values, TPH says they are to be accountable and transparent, but there are no communications to families about the dangers. Another value of being credible and evidence-informed would mean that the evidence-informed information should be reaching our communities, but it is not. I urge you to look at the communications to schools and make sure that parents are well informed about the ongoing risks before school resumes in September again. The school boards defer to you, so it is imperative that you are doing something. Priority 1 requires you to do this in Objective A, preparing for and responding to outbreaks informed by best evidence, and Objective C, effectively communicate with the public about how they can protect their health. In addition to clean air and clean communications, reinstating masking in hospitals aligns with the vision, mission, your values, and priorities. Removing masking in hospitals does not allow you to attain any of these. Under your vision, a city where all people can be healthy and thrive, and mission, TPH protects and improves health at the population level while reducing health inequities, means that all people, those at high risk and not, should be able to access healthcare without the threat of catching something else while doing it. COVID can spread asymptomatically, so relying on symptoms to require masking is not protecting those that access care. Currently, many are avoiding accessing needed healthcare due to the threat of catching something else and making themselves sicker. Under Priority 1, TPH will prepare for and respond to outbreaks and public health emergencies informed by best evidence and lessons learned from previous responses. Best evidence says that respirators are the best line of defense against an airborne disease. While we are still learning lessons from the current pandemic, we are not employing them. Instead, we are ignoring them. Priority 1, Objective C, says to effectively communicate with the public about how they can protect their health. By removing masking in hospitals, the public and healthcare workers think it is not necessary. For those of us informed, we know different. By removing the requirement, patients and their families, some unable to mask due to age or other reasons, are now having to fight with their clinicians to mask while they access care. Masking should be mandatory in healthcare settings to protect both the patient and the clinician.
Your time.
I've just got one line left.
Go ahead.
In closing, I'd like to say that it should not be this hard to protect our health. It should not be this hard to protect our children. We have upstream prevention tools and knowledge. I hope that the board will see the benefits of investment now for the rewards later. Thank you.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in today. Mary Jo Nabers, you're online. Mary, are you here?
Yes, Mary Jo Neighbors. Yes. Let me just get the screen share going.
Okay, you have 5 minutes.
Okay, it just says that I'm not allowed to share yet. Have you done that for me?
You should be fine now.
Oh, now I can. Okay. Let me just find it because this is always an unusual setup for most people in the public.
Okay, there we go. 5 minutes.
Thank you. Thank you. Hello, everyone. Subsequent to my June 4th deputation as a proxy for Ward 15 TDSB parent, I'm following up with both their oral and written submissions. As per your strategic plan's final draft goals, you mentioned advocating for conditions to improve the health of residents. Example, clean air. You also state your #1 priority is to strengthen health protection, disease prevention, and effectively communicate with the public about how they can protect their health. In light of this, I want to stress the importance of a TPH doing a back-to-school comms campaign on airborne illness prevention and risks to fulfill those stated goals. A comms campaign that highlights the following. #1, how to stop airborne spread with layers of mitigations, as per your website. Please stress the importance of open windows and doors and turned on HEPA filters to maximize ventilation and filtration for the cleanest and safest shared indoor air possible. Please promote and destigmatize masking. Please partner with schools and childcare centers to build do-it-yourself air cleaners like Corsi Rosenthal boxes. Toronto schools and childcare centers have been actively blocking these air cleaners, including Toronto Public Health itself, while BC cities run partnership programs to build them, and Northern Ontario schools have had them for some years now. But now that these are included in your plans for wildfire smoke prevention, there should no longer be any barriers to their use in Toronto learning environments. None. For number 2, long COVID risks of airborne infection and reinfection, as per your website. Please educate families and staff so they understand why airborne spread prevention matters. Your site identifies that long COVID may mean there are children having new difficulties learning in school and changes in mood. This is vital information that families and staff need to have and to monitor for. As ongoing discussion on violence in schools takes place, it's imperative that families and educators understand that long COVID can be a factor and that the best way to prevent long COVID is by not getting a COVID-19 infection. This is perhaps the most relevant example of the earliest stage of prevention that Dr. Davila stressed so clearly this morning. Correspondence shared with you demonstrates that despite repeatedly referring to Toronto Public Health's long COVID information and airborne illness prevention recommendations, when I'm asking for these things for those reasons, I've been outright informed that there are no mandates by my principal and by my ETFO-TDSB educator co-parent that no one is masking or following illness screening forms in schools. Doors remain shut, windows closed, HEPA's off, CR boxes unused, despite duty of care and your public health recommendations. Trying to protect my child and household with your public health recommendations, but without your help, has had a negative impact on my relations with both my child's school and co-parent. Event after event, year after year now, I've documented and shared carbon dioxide, CO2 data showing the poor shared indoor air quality during reported surges that also fits in the cognitive effects measurable and significant categories as per this 2015 article. My child attends school and events unmasked on the days that they're not in my care. In addition to multiple other illnesses, my child has been hit with 3 illnesses in a row, 2 years running, most recently this May. Back and forth to the doctor we go. I nurse my child back to health only to send them back into the same airborne illness cesspool, all while understanding that my child is 1 infection away from preventable long COVID harms, per your website. Many of the parents who spoke with TVO today say they've tried to bring these issues to their school administrators, trustees, school boards, and the province, but they feel stonewalled. It shouldn't be this hard. TPH's very reason for existence is to do this work explicitly stated in your strategic plan goals. So run a back to school comms campaign to address airborne disease spread and prevention, and that includes long COVID infection and reinfection risks that families and staff clearly don't understand. Please stop the never-ending year-long cycle of preventable airborne illnesses in our schools. Make the guidance stakes crystal clear. We need you to do your job on this urgently. Meeting the changing needs of children and youth that Dr. Davila explained today is your priority number 2. 5.8 million US long COVID kids and counting, 112,000 UK long COVID kids and counting. Canada isn't even counting yet. There's nothing more basic than breathing. Indoor air is shared and its quality is impacted by everyone sharing it. So what will you be able to say that you did to protect the health and safety of an entire generation of children from the preventable airborne harms stated on your own website and to achieve your own strategic plan goals? Thank you.
Thank you. Any questions with Deputant? Seeing none, thank you for coming in today.
Thank you.
Untitled Chapter, online. Untitled. Are you there? Okay. Can you unmute yourself? Here you go. We can see, but we cannot hear you. Nope.
How about that?
Yes, we can hear you now. We have 5 minutes. Go ahead.
Great. I'm just going to share my screen. It says I can't share. Oh, now we go. There we go. Thank you.
Okay, go ahead.
Thank you very much. you see that okay?
Yes, we can.
Great. All right. Thank you. Hello, my name is Nithal, and thank you, committee members, for the opportunity to speak today. You might remember me from last month's meeting as the deputant with many slides on the real-time tech bill. As a reminder, I'm a plant-based nutrition economist and policy analyst and serve on the boards of several nonprofit organizations. First up, I'd just like to applaud the committee members and staff on the great work done thus far on the strategic plan, and I'm here today largely to speak to operationalization. So as the plan outlines, as you're well aware, you're seeking to maximize health status and optimize investments in public health. And priority 1 includes effective communication with the public about how they can protect their health. And priority number 2 speaks to the importance of collaboration, effective interventions for children, and reducing the burden of chronic and infectious diseases. I'm going to speak to these priorities, but to frame why I'm here right now is to underscore the importance of lifestyle medicine, which has incredible health benefits through all phases of lifespan, and which I don't think the committee heard much about during the consultation process, as well done as it was. It continues to be under-focused in public health, including in med school, and focuses on 6 key pillars, as you can see here. But I'll just focus on the most important pillar today, whole plant-based foods, given the general confusion around nutrition and food choice in Toronto today. Something we saw at VegTO when we polled the public through Angus Reid 2 years ago. So just for context, chronic diseases are largely preventable, account for 90% of all deaths, and yet continue to account, well, generally, in Toronto it's the bulk. And they also adversely affect marginalized and racialized populations more. They also now account for more than $80 billion of federal healthcare spending, or 12% of our national GDP, and over 40% of Ontario's budget. The thing is, healthy lifestyle behaviors and whole plant-based foods have the potential to prevent and even reverse these chronic diseases, including up to 80% of type 2 diabetes and heart disease, and 40% of cancers, among many other diseases. I've seen this firsthand for decades and through my father's medical practice. So through focusing on raising consumption of these foods, the city could have a massive impact on public health outcomes and healthcare savings alone. Unfortunately, as you know, and as Dr. Davila spoke to earlier a bit about on the profile report, included in that was 4 in 5 adults defining that 4 in 5 aren't even meeting the minimum RDA of 5 fruits and vegetables today. So with that said, there are 4 key areas I strongly urge the committee and Board of Health to focus on in terms of operationalizing this plan. First, the lowest hanging fruit, wider operationalization of the Canada Food Guide. As you can see from the middle graph here, a poll we ran at VegTO through Angus Reid found that over 2/3 of GTA residents do not use the food guide, and 12% have never heard of it. And through my involvement in the Coalition for Healthy School Foods, I've also regularly seen and heard that it's not being widely used in schools either. And I just can't fathom how we continue to allow children and students to eat processed meats. One example. And generally, on the note of raising whole plant-based food consumption, we found that just under 2/3 of the city are game, and almost 94% exactly actually support more of these foods in public spaces, including over half who say they would eat more of them if they were more widely available. So just want to make you aware, an easy way to ensure we optimize delivery of this strategic plan objective is to simply make plant-based options the default choice, wherever possible, which can increase their uptake by 60% while preserving the freedom of choice. And New York City is currently doing this in schools and hospitals with great success and high satisfaction rates. I'll skip past this Copenhagen example for the interest of time, but you have it in the deck to refer to. It's some great work there. My second recommendation on implementation speaks to the first priority on effective communication. Over half of GTA residents are either skeptical or unaware of key healthcare findings in research, such as processed meat being a known carcinogen and the benefits of whole plant-based foods on disease, including on gut health and COVID-19. This should be a big area of focus in implementing this priority. Third, it is critical that the Board of Health coordinate policy horizontally, across divisions, and vertically with the provincial and federal government, especially where there's shared jurisdiction. And I would ask that special attention be given to the student nutrition program, especially in light of the forthcoming rollout of the new National School Food Program. Greater whole plant-based foods also generally reduce pandemic risk and would greatly reduce food costs for households significantly. So in implementing this plan and focusing more on whole plant foods, the Board of Health must coordinate well with environment and climate, with whom some of my colleagues have been consulting and partnering, such as through training city and nonprofit chefs, given that food is now the #1 source of emissions, and of which meat and dairy account for over 1/3. And it's especially important that the Board of Health prioritize childhood nutrition. I'd like to underscore a graph here in my last few seconds by my colleague, Dr. Rikin Patel, on the importance of dietary influence on chronic disease at a young age. And finally, I see I'm over time, so I just want to
Yes, you are.
emphasize I'm here with my networks and any collaboration that you need, and happy to leverage my resources. Thank you very much.
Any questions for Deputy? Seeing none, thank you. Marina Kolodinger? Marina? Okay, you have 5 minutes. We're just a quorum, so if anyone is stepping away, please let us know. Otherwise, we will lose quorum.
I'm sorry. If you please connect it. Is it here? That's it here?
I need to plug this first.
I'm going to start your time.
Thank you. I apologize to everybody. I didn't realize it will take me some time. But my presentation will be shorter than 5 minutes.
You can start.
Okay. So, dear ladies and gentlemen, 24 years ago, I moved into an apartment in a concrete high-rise, got stuck there due to circumstances that were beyond my control, and developed a chronic sleep disorder and depression that lasted for many years due to excessive, unnecessary, sporadic noises every night and early morning. Unfortunately, I am not the only one whose health and professional career have been ruined due to interrupted sleep every night for many years. All these noises can be completely blocked or seriously mitigated with modern top-notch materials and technology. Any repairs and renovations are 100% tax deductible. However, landlords do not do them in order to make a frustrated old tenant move out and let the vacated apartment to a new tenant for a higher rent. Furthermore, landlords save big money on hydro when ventilation or heating systems do not work properly. We live in a capitalist country, and landlords are motivated by maximum profit. Why won't we turn their desire to make big money to our benefit? With this in view, I would like to reference the city's tower renewal programs that give long-term, low-interest government loans to landlords for the repairs that had been approved by the city, and these loans could turn into grants upon completion. Unfortunately, tower renewal programs do not cover noise-related and some other necessary repairs. Maybe it's time that they would extend their coverage to, first, noise-related repairs and improvements such as commercial carpeting of stairwells and floors, proper soundproofing of outside and inside walls in the buildings, as well as the floors in between different stories of the buildings, new good solid apartment doors, noiseless building entrance and exit doors, garbage rooms, and whatever is required to block or at least significantly mitigate unwanted and unnecessary sounds originating inside the buildings. Second, ventilation. It is very poor in old buildings. Most of the rooftop fans date back to the 60s and 70s, when the buildings were erected, and their age exceeds several times the 15 to 20 years lifespan of an ordinary commercial rooftop fan. This lifespan, if the rooftop top fan was properly maintained all the time, of course. 3. Installation of modern security cameras and noise meters in buildings, in building common areas, stairwells, lobbies, as well as doorbells on apartment doors. These measures could also contribute to safer and more quiet communities. Maybe it is time to introduce financial penalties for landlords who do not perform their obligations. On the other hand, those who fulfill their duties honestly could be entitled to tax benefits in addition to loans and grants. Thank you for listening.
Thank you very much. Any questions for the deputant? Seeing none, thank you for coming in today.
Any questions?
No questions. David Needham, are you here? David Needham? Okay, we'll come back to him. Kathy McLaughlin? You have 5 minutes, Kathy?
Thank you. Good morning. My name is Kathy McLaughlin. Thank you to the Board of Health Committee for agreeing to hear us today. Also, many thanks to Ingrid Bude, No More Noise Toronto, for starting and continuing to keep this charge moving. And thank you, Dr. Davila, for helping to keep us safe and informed during COVID days. I've lived near the Bayview Bloor cutoff of the DVP in a condo high-rise for 25 years. Our building has spectacular views, and we've always used the balcony as an extra room during the milder months. At the beginning of COVID, we started noticing very loud backfiring and revving of motorcycles and cars in the evening and overnight in the neighborhood. We started losing sleep when these guys started their revving and racing up the street. Initially, I called the police to report this excess noise, and I was told to call 311. 311 was not particularly helpful, sometimes telling me to call the police, who told me to call 311. Just an endless circle. The noise continues on throughout the night, and it's only getting louder. When they get bored with the DVP, they just move to Broadview or surrounding streets. We tried closing our windows, no luck. The vehicles are so loud, they still wake me up even though I'm on medication for it. The regular elevator conversation with my neighbors goes something like, can you believe how loud that, what the hell is going on out there? The noise has become so loud, we can actually no longer even enjoy our balcony, and we often now keep all our windows closed, which is a real drag during the warm weather. Even though I'm on medication for it, the noise is so loud it awakens me from sleep. I feel exhausted as a result. I had professional earplugs made some time ago, but that hasn't worked. And the doc said if he made them any more silent, he was concerned I might miss something important like fire alarm or sirens. We added a white noise machine to assist us fall asleep. But when the machine times out, the vehicle noise interferes once again. I often find myself standing in my condo, glaring out the windows at them and swearing. I'm so angry that I don't recognize myself any longer. I feel helpless against them. I feel depressed, anxious. Where can I go to not hear them? It's only getting worse. You have no idea how loud and how constant it is. Do I actually have to move away? And where am I going to go? It's everywhere. It's not isolated to my neighborhood. Do I have to go to the roadside to confront them? There's got to be an answer. My mental health is suffering seriously here, and I can't enjoy my home unless I'm in town on one of those weekends when the DVP gets closed for maintenance or a bike-a-thon. Those modified mufflers are against the law anyway. Why are they allowed to be used? To create this chaos for people? I can assure you this is a public health issue for so many people, not just me. Why not use noise cameras like they do in New York City? There's other ways to manage this. Please make excess noise of all types a priority in your agenda. We're counting on you. Please find the smart, fast deterrent to this behavior before we all lose our minds or more people get hurt. Respectfully submitted.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in. Alex Thompson. Okay, you have 5 minutes.
Thank you, Chairman Moyes, and all members here today. A lot of faces out. It's nice to hear that there's a lot of attention being paid. Thank you for your strategic plan. I think it's wonderful. But I too have issues with noise. I live on Broadview Avenue, overlook the Don Valley Parkway from our balcony and from our windows, which remain closed constantly. Modified mufflers and motorcycles are probably my two biggest complaints. You've heard the stories, you know the stories. 311 tells us to phone the police tell us to phone 311, and there's no resolution. We know that many of you have heard from us before, and all we can do is to continue to speak. We know that you're working on it. We know that there are plans in place, and we're really quite happy with that. Special thanks and shout out to Ingrid Boudet for all the work that she does to keep us in front of you and to keep you in front of us. There are things that we've discussed before. We'll discuss them again. Noise cameras, with great success in New York City, for example, and our police services. Our police services need your input. They can't do anything on their own. They can only do things when they have a law in place that they can enforce. They have no teeth right now because they have nothing to deal with. They just don't have a law in place. If the car is stationary, they can deal with it. But if it's moving, they have nothing, is my understanding. And until those things change, and until they have something that they can deal with, this will just continue. So I do appreciate all the work that you do, but we're out there, and we really need your support in this. It's truly a mental health issue, but I do thank you for your time, and I thank you for your work.
You want to say something?
I just have a quick question. Well, thank you for being here along with all the other deputants, and I certainly can sympathize that the revving and the out of control noise of the altered mufflers is something that impacts most of us, whether we're walking down the street or animals, everybody's affected. The only question I had was, are you aware that the provincial government has to make changes of legislation to ensure that there's the governing of highway traffic and the certain things that have to do with the functioning of the industry are not the purview of the Board of Health or to govern, or the City of Toronto. So will you be doing advocacy with the provincial government to make sure that there's some study and changes there?
Absolutely. Yes, we're pursuing that with them as well. But it has to come, I mean, the City of Toronto has a lot of clout, I think.
That is a debatable thing given the fact that we have half as many councillors as we should.
Agreed.
But I certainly, as you indicated, the forthcoming noise report is an important opportunity, but I think it's important for members of the public to really understand that we need a provincial partner, and in many ways, there's a manufacturing question here about why they can be altered at will, and that's a federally regulated challenge. So thanks.
Yeah, it affects all levels of government, but certainly the Board of Health have a lot of clout with the city, and the city has hopefully some clout with the province, and that's what we're hoping, is that we can drive this from a couple of different angles. But again, thank you for your work on this.
Thank you.
Thanks very much.
Thank you. Is David Needham back in the room?
Yes.
Okay, you have 5 minutes.
Thank you. A personal story. Before moving back to Toronto, I lived in France for 15 years. And we were there during the height of what the French called the rodeo movement. It was altered motorcycles driving up and down the streets at night. And this led to a public health crisis in France. And the response initially was doctors prescribing antidepressants at very high levels. We, for a number of reasons, left and moved back to Canada, and one of them that was the noise issue. People ask, do you miss Paris? And I say, no, I do not. Back in Toronto, we now live at Queens Quay and Spadina. When we moved back, we could sleep with our doors open in our condominium. We no longer can. And COVID seems to have been a turning point. The modified vehicles along the streets became more and more prevalent and louder. And somebody has just spoken to policing. The time we've lived there, 10, 12 years, we've never seen a police check on the streets outside of our condo building. Speaking of equity, we have come up with a personal solution, which was to soundproof our bedroom. There are 2 windows in that bedroom. The price, unfortunately, and we checked around North America for suppliers, for doubling the window system, including the ventilation, so that once the windows were closed, we could still breathe easily, was $12,000 for the windows, and another $3,000 for the ventilation, so a total of $15,000, which we were able to pay. But I look out my window and I see buildings, rental buildings and others, where people do not have that option. So I would lend my voice to others in saying, please do what you can at your level to address this problem of modified vehicle noise. Thank you.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in. David Cohon, are you online? No? Okay. And that's the end of our speakers list for this item, 14.1. I'll take it in-house now. Any questions for staff from the directors? Councilor Bravo, you go ahead.
Thank you, Chair, and through you, I want to ask the Medical Officer of Health just what we're deliberating today is the strategic plan, and just to clarify, as a purpose, I think in your remarks you said this is a guide in terms of how the vision, what we're driving toward, the mission, how we get there, the values, the choices that are going to inform the choices that we make, the priorities and objectives are really about setting the big frame. But this isn't, what we have before us isn't necessarily the list of activities or specific programs, correct?
So through the chair, yes, that's correct. So there is more work to be done, and that will require the engagement of the specific skills of our staff so that we can get it down to the level of granularity that's required for activities, and subsequently to develop the monitoring plan so that you know what indicators are coming forward when we report back on an annual basis to this board.
So there'll be implementation, and the strategic plan, it's an opportunity to set out the goalposts, but how we actually meet them will come with more detail and metrics. Thanks.
That's correct.
The second question has to do with, we've heard many questions about, many deputations today about noise. Can you comment on the review of noise action plan that's coming next year? My question is specifically around when we develop a strategy to address a major social problem, socioeconomic, environmental problem. There are many steps that we would need to take at working from a public health perspective, as I understand it. For example, around addictions and mental health, there was a robust process, and there's a lot that has to be done to make sure that we're hitting the right requirements. And secondly, it's a big question. The noise piece there's a lot of different divisions involved, correct? Unlike many other, there are the social determinants of health are impacted by many divisions, but this one in particular is really around regulation and enforcement in many ways, and so that's a challenge, I would assume.
So through the chair, Vice Chair, you're right. This is a very complex issue, and you've heard from the presentations and deputations today how many different elements there are and dimensions there are to this issue. Also, you'll recall that we did put forward a report a number of years ago on noise, and we fully recognize the significant impact that excessive noise can have on health. But exactly to your point, actually getting around to addressing the challenges and ensuring the environment is as healthy as is humanly possible requires the interaction and engagement of several different actors, many of whom are city divisions, and I think in the conversation we've had to date also requires actions and interventions from other levels of government. So there are reports coming forward in the next little while. We talked about Q1 of next year, but certainly there's work that's going on now, but reporting that is really coming formally both to this Board of Health and other committees of the city in respect of this issue to explain what's happening and what is envisioned then by way of next steps in order to address this very complex and very challenging issue.
Okay, thank you. Any other questions? Dr. Zhao?
So some of the deputants today have talked about Toronto Public Health's large social media presence as an educational tool. I was wondering, what is Toronto Public Health doing when it comes to educating the public about noise, and whether there are like Twitter posts or other social media posts available to educate the public about what they can do about noise?
So through the chair, I don't know that I can delineate specifically every post that we've ever done on the issue of noise, but certainly we use our social media platforms and all our communications channels. That's only one, certainly a very powerful one, but whether the issue is in respect of noise or frankly any other issue impacting health, where we know that we have a message that we can provide and actually support and create that environment that allows for better health, promotes better health, protects health of the public, we use all of the channels available to us. That's one method. We also know that there are significant elements that need to happen. As you heard through the strategic plan, there may be policy initiatives that can be undertaken, planning endeavors that are part and parcel of this. And you've heard there are significant issues in and around traffic as well. And again, we're working with the relevant partners and influencing them as best we can, recognizing that many of the areas are outside of the direct purview of public health. But as we do with so many issues, we do bring forward, the best available evidence and seek to influence and advocate as best we can.
Okay, thank you. I have a question. So the one thing, looking at priority number 5, it talks about nurture positive workplace culture. And I know that could mean a lot of things, but it doesn't touch on employment inequities, basic income, for example. Do you think those things should perhaps be considered, or is it assumed to have been considered in this report?
So through you, Mr. Chair, this is actually specifically around the workplace culture within Toronto Public Health. We spoke about the importance of, we're not a capital-heavy environment, unlike other divisions in the city. The work that is done at Toronto Public Health, our ability to be effective, actually rests on having the appropriate talent pool and the kind of environment that allows that talent pool to use its skill set as best as possible to serve the 3 million plus patients of ours as Toronto Public Health. So it's largely focused on that. There are, of course, other issues with respect to determinants of health. We spoke a little bit about housing as a key factor impacting health. Certainly income is a key factor affecting health, and that's for the entire population. No question about that. But priority 5 is specifically around ensuring that we have a talented and diverse workforce that's well positioned to actually address the needs of the public, and that we're constantly seeking to innovate, that we create a culture of constantly seeking to understand what's driving health, whether it's good health or ill health that we're talking about, and that we're using our skills as best as possible to actually promote health and prevent disease and protect health.
Okay, thank you for that. I do have one follow-up. So yes, the focus is on Toronto Public Health, but would it not have been implied perhaps that you use other city departments to help meet the needs of the people of Toronto?
So through you, Mr. Chair, you'll notice that we have that addressed through the variety of other priorities. So we look at priority 4, just working our way backwards from 5, advocating to advance health equity. We cannot do that on our own. That's the kind of work that we do in partnership. Yes, with other city divisions, and I would argue with other community partners and with other levels of government. Looking back at, I can tie that into priority 3 as well, but priority 2, the notion of promoting health and well-being across the lifespan, there are certainly some components that we can undertake relatively in isolation, if I can use that term, or by ourselves as Toronto Public Health. But the vast majority of that which we do, creating the conditions that actually promote and protect health as best as possible, by definition includes interactions, influencing other partners, whether they're city divisions or other organizations within the government or outside of government, and as well speaks to our role in advocating for important policies and for changes to the environment that actually promote and improve health.
Thank you. Those are my questions. And seeing no other questions. Oh, sorry, Deputy Mayor Malik, my apologies. You're all the way over there. Go ahead.
And this chair is very low and I can't lift it up, so that will be. Well, first of all, I just want to thank all the deputants and everyone who has been part of the process to bring together this strategic plan and also to raise some of the key priorities as we move forward with this plan and in all of our considerations. I guess one of the pieces that was raised, and particularly by the last speaker, was what has changed coming through the pandemic, especially since the last public health strategy was created well before the pandemic. And I'd just like to hear a little bit more about what were some of the most significant changes we're seeing in this updated strategy, and how will that kind of change in context and the learnings coming through the pandemic inform our work going forward?
So through the chair, thank you very much. That's a great question. And let me try to articulate a couple of points in particular that really came through since the pandemic. So one of the points that I made in the presentation was that we did hear a lot about the need to protect health, infectious diseases, and the importance of actually doing that core, basic foundational work of public health to ensure that we're protecting our community as best as possible against what we know are emerging infectious diseases. Some of them are in fact re-emerging. So we've seen challenges. I mentioned a little bit about measles and mpox, and of course we continue to have challenges in respect of COVID-19. That hasn't gone away. Another issue you've likely been hearing about through media reports includes, the potential for H5N1 avian influenza, and what that might mean for the future. So there are many different issues that are constantly emerging. And one of the things that we certainly heard about through the engagement process was the importance of us as Toronto Public Health to be actively engaged and constantly investing in our ability to protect the city as best as possible and to provide good advice on infectious disease prevention and mitigation. I think the other things that really came through this time around, particularly as we look at our circumstances emerging from COVID-19, certainly mental health and substance use was another issue. Problematic substance use and worsening mental health was something that really came through as something that's changed in the landscape relative to what the city was facing prior to COVID-19. And I think if I were to mention another one, I could go on, but I will try to be respectful of time. The housing crisis and housing and food insecurity has certainly emerged as one of the things that came through the conversations and something we heard about through many of our engagements and feedback opportunities in the development of the strategic plan. Of course, we have some purview over elements of all of these things, but as you know, Deputy Mayor Malik, they're multifaceted issues that will require active collaboration with other partners if we are to be successful in terms of addressing them. But as we move to the next steps of this strategic plan, as I mentioned in an answer to Vice Chair Bravo's question, we're going to engage with our staff to actually, continue working down the strategic plan to a more granular level and to specific activities, and ultimately to performance indicators that we can bring back to the board. Clearly, we're going to try to influence broad issues, social determinants of health, and will also include those elements where we have more direct control or more direct purview. So you'll see a little bit of both of those things as we come forward with next steps.
Thank you very much. And I'll just share one more question, which is also, kind of the unique context that we're in as this strategy is being developed, is that this new strategy will be in place as we look to welcome a new medical officer of health in the new year. And I just want to also hear a little bit more about how we see this strategy influencing their onboarding, what that consideration kind of, if it was part of the discussions at all, and how you see it supporting them in doing their job well.
So through the chair, another great question, Deputy Mayor Malik. I will say this, there is a subcommittee that clearly is going to be formed, and there is an undertaking and a whole process that has to be engaged in respect of recruiting the next medical officer of health. But when I look at these priorities and when we think about the process and the engagement that we had with the Strategic Plan Development Committee, I think that these are priorities that will, see us through regardless of who has the privilege and honor of sitting in this seat. These are things that are clearly premised on the needs that we're seeing in the community, the health needs that we see in the community, now and for the foreseeable future. I think they also reflect the kinds of things that we know. It reflects the evidence that we know, where we can actually have a difference, where we can have impact in terms of actually improving health. So I do believe that these are going to serve this organization and the board well, and frankly, ultimately, the goal is to serve the city, the needs of the residents, and to ensure that we're undertaking actions with the guidance of this strategic plan in a manner that reflects the evidence, reflects the needs of the community, and gives us a path forward where we're most likely to be successful in delivering on our obligation to improve health, to make this as healthy a city as is humanly possible, to reduce those inequities, and to ensure that we are ready to respond and able to respond effectively to whatever comes our way.
Okay, thank you. Director Uzde, you have a question?
First of all, I want to say thank you so much for the work done in creating this strategic plan. So I was reading through the report and curious about priority 2. So priority 2A on effective interventions for children and youth. I know that COVID affected all of us quite severely, but children and youth were probably the most severe because they missed some key development things during the pandemic. And I even read a report by CBC that just seems to be some correlation to youth who were affected by gun violence, and how the impact of COVID may have affected them. So I'm curious for children and youth specific to mental health, what could some of those effective interventions look like?
So through the chair, very briefly, that's exactly the kind of conversation that we're going to be having with our staff to get this down to the level of granularity that allows us to specify activities. But there's no question that there's evidence out there that speaks to the kinds of things that we can do, yes, as public health, but also the kinds of things that we can influence our other partners with in order to actually address the challenges that we're seeing amongst children and youth. So some of the elements that we're going to be able to do are going to be the kinds of programming and services that we conduct currently as public health with young families. We have a number of programs and interventions that are actually specifically directed towards creating a healthy environment at the earliest stages of life, working directly with families so that they are able to create safe, nurturing environments as best as possible for their own unique circumstances. We also work significantly with our school partners and with the many resources, including School Mental Health Ontario, to create safe and nurturing environments within the school. And we support educators in terms of being able to identify specific challenges and to introduce elements into the curriculum that actually allow for better health to be experienced by all children. It can also come in the form of the kind of work that this board has supported through things like the student nutrition program, right? That may, in the face of it, appear to be something that is very focused on healthy nutrition and access to food, which is of course important. But you can appreciate that that has a much broader health impact than just the food itself. So these are just a few of the kinds of examples that I can offer you at this point, but certainly that's the kind of discussion that we want to have within our staff, with our partners, and then we'll continue to report back to the board on as we get into the specifics and the reporting plan for the board and for the public to know what it is that we're doing and how well we're doing it.
Thank you so much for that. And just as a follow-up question related to the deputations around noise pollution, I was reading that some cities, specifically Barcelona, they had some interventions where there was moves by the city council there to reduce reliance on vehicles and promote more active transportation as actually a way to reduce noise pollution at Innova. And I know that public health does collaborate with different city departments. So I'm curious if this is something that TPH could also take a lead on.
So through the chair, yes. In fact, if you look back at our reports on this very subject, when we look at the data, and we've made this recommendation before, we know that a significant component of the noise that exists within the city is related to vehicular traffic. And so one of the areas that we've made recommendations on is to really look at that issue and seek to provide for more access, to facilitate better access to active transportation routes. Yes, because that reduces noise related to cars and trucks, but as well, it also happens to serve, a physical activity objective that we have in terms of public health. Promoting more forms of active transportation, yes, reduces noise from cars moving in and around the city, but it also promotes more physical activity, whether it's through cycling or walking, even public transport. In order to use public transport, you generally have to walk to the subway station or to the bus stop. So again, lots of reasons for us from a public health perspective to support forms of active transportation.
Yeah, thank you. Any further questions from anyone? Seeing none, speakers? Councilor Bravo.
Thank you, Chair. I have a motion that the Board of Health adopt the following recommendations in the report, and that also there are additional recommendations in the letter that was circulated from the Board of Health Strategic Plan Development Committee dated June 4th. The Board of Health, it essentially recommends 6 things. That the Board of Health direct the Medical Officer of Health to develop an implementation plan on the 2024 to 2028 strategic plan, and then there's reporting on annual reporting on progress on the implementation of the plan, to develop a public dashboard that will track the progress so that it can be publicly available, that there is a section in all reports indicating how does this work align with the strategic priorities and objectives that have been set in the strategic plan, and that progress on implementation of the forthcoming strategic plan, if adopted, should be a metric integrated into the performance appraisal of the Medical Officer of Health going forward, and that that the Medical Officer of Health report to the Board of Health in the 3rd quarter of 2027 with an interim report on the full implementation of the plan, so that this can inform the next stage of the next strategic planning process, and that there's also reporting on recommendations on reestablishing the strategic planning, the Strategic Plan Development Committee. And finally, something I know the Medical Officer of Health probably plans to do, but to just put it in here, to monitor forthcoming changes to the Ontario Public Health Standards and report to the board on changes and their impact, as these are so important to the work that's done here. I want to start by saying that it has been a tremendous privilege to have chaired this strategic planning committee. I am very grateful to the members of the committee. Everyone has participated with so much commitment and with the spirit of listening to expertise and lived experience in relation to what is really threatening the population level health of the people of Toronto and how to improve the outcomes. I want to thank the members, Member Abhinaya Chandrabalan, the Deputy Mayor Morley, Trustee Anu Sriskanda Raja, and the member, Dr. Stephanie Zhu, who we've worked together, and I really appreciate that. I think it's important to note that so much work was done here, that there were almost 1,400, I'll say more than 1,300 individuals and more than 70 organizations from across Toronto that were engaged in, I think, what was truly a participatory process. I think the evidence is in all of the reports from the Strategic Planning Committee to this committee. Lots of people came out to consider and to give reflections on what needed to be included in this plan. The subcommittee decided early to not just look at the directions going forward, but through the discussions and the pretty deliberative process with a lot of help from clerks who gave us a lot of leeway to be able to talk to each other and not have this procedural elements impede a really deep look at what was important, that we were able to decide to look at whether the vision and mission were really still relevant. And while there hasn't been a radical change, I think there's been some important improvements that really put people at the center of this work. Secondly, that there was the mission and the work around values, I think, and principles to inform how public health will move forward are really important elements of a strategic plan, because they make apparent how the priorities are, how the resources are going to be allocated based on what values, and how that work will be carried out, and that was important. I also, of course, want to acknowledge the importance of having such competent professional staff, and it's impossible to mention everyone, but to really thank Upala Chandrasekhara, Vanessa Fletcher, and Dominic Popovich, and the whole Strategic Initiatives team for the collaboration and the partnership that we were able to develop in doing this work, and also in a very fluid way. This is going to put public health in a position to be more proactive, more of an advocate, moving forward in a good way, and to continue to work in deep commitment with community. And I just want to, I know, thank you for the extra time, Mr. Chair, but I do want to say that there are so many struggles that people are facing, and many people can't come forward in this kind of environment to speak for themselves. I think about all the children that have come through the pandemic, and with the many, many challenges, and people who are unhoused, people with unmet health care needs, people who are suffering because of climate change impacts on their lives. And it's important that those organizations who represent tens of thousands and hundreds of thousands of people came forward to give us a really big picture, in addition to all the many people who take their time on a regular basis to come and speak to the issues that matter at this committee. So thanks to everyone, and I appreciate the extra time, Chair.
No worries. I allow you the extra time so you are thanking everyone, so I don't have to do it. But thank you to everyone, though. And thank you to you. Are there any other speakers in this item? Seeing none. You've done a great job summarizing, so I will not even go over it. High five. Okay, so we'll put the item on the screen. So it's moved by Councilor Bravo. All those in favor of this item? Opposed? Carried? Is the item as amended? Okay, and that's it. Okay. Yay. Before we proceed to the next item, I need to get the will of the board if they want to continue. Until 1:30 max? No? You have a meeting at 1? You have a meeting at 1 as well? Okay, so I guess we'll break at 12:30. So we can
push through till 1 is what they're saying.
we can,
We're just gonna have to hustle.
okay, we can push through till 1. Okay, let's extend until 1 o'clock. All those in favor? Opposed? Carried. Okay.
I'm just gonna toss it right
Okay, yes, go ahead. Item number 2.
So thank you, Mr. Chair. I'm going to turn it right over to my colleagues, Dr. Finkelstein and Dr. Shapiro, for a presentation on the wildfire approach that we have for this year.
And a good afternoon, everybody. With me presenting this afternoon is Dr. Shapiro, an Associate Medical Officer of Health with Toronto Public Health, who provides public health consultations to the Healthy Environments programs in several different areas, including wildfire smoke strategy. The report that is before the Board of Health this afternoon is an update to the wildfire smoke strategy first drafted in the summer of 2023. Next slide, please. Last year was an unprecedented year for the impact of wildfire smoke on the air quality in Toronto and Southern Ontario. From June through the summer months last year, 3 special air quality statements were issued by Environment and Climate Change Canada and the Ministry of Environment, Conservation and Parks, drawing attention to the impacts of wildfire smoke on the air quality of Toronto and surrounding regions. These statements covered a total of 12 days when air quality was significantly degraded by smoke from wildfires, mostly burning in Quebec. At that time, the board requested that the Medical Officer of Health develop a wildfire smoke response strategy, which was quickly developed and published in the summer of 2023. It provided guidance on how residents could reduce their risk of health impacts of poor air quality, guided by the Air Quality Health Index, and accompanying advice published by Environment and Climate Change Canada and Health Canada. Our strategy was meant to be iterative and updated as the wildfire situation evolved. Toronto Public Health recently published the updated strategy on our website after receiving new guidance from the Ministry of Health, consulting with other jurisdictions that have more experience with wildfire smoke, and reviewing data from our own situation. Next slide. Last year, as you can see on this graph, was an unprecedented year for wildfires in Canada. As you can see from this graph, which shows the estimated annual area of forest that was burned in wildfires each year since 1982, in 2023, an estimated 17.3 million hectares, or 66,000 square miles of forest, were burned in over 6,000 wildfires in Canada. This was more than double the nearest year for total area burned in Canada, which was back in 1995, when less than 8 million hectares were burned. I'm going to turn it over to Dr. Shapiro to talk about the potential impacts of wildfire smoke and our updated response strategy. Howard.
Next slide. Wildfire smoke is more than a nuisance. It has significant health impacts. It is composed of a complex mixture of particles and gases known to be harmful to health. Particulates are thought to be the most concerning component of wildfire smoke from a health perspective, particularly those that are small enough to penetrate deep into the lungs and even enter the bloodstream. They are referred to as PM 2.5, which means particles less than 2.5 millionths of a meter in diameter, which is approximately 30 times less than the width of a human hair. And it can make up to 95% of the total particle mass of wildfire smoke. While some of the harmful health effects of wildfire smoke are known, this continues to be an ongoing area of scientific research. Next slide. When people are exposed to wildfire smoke, there are parts of the body, such as the mucosal surfaces of the eyes, nose, throat, that can be impacted quickly, leading to eye irritation, sore throat, runny nose, and cough. The small size of PM 2.5 allows them to be inhaled deep into the lungs and be absorbed into the body, causing more systemic and serious health effects affecting breathing and the heart. For people with pre-existing health conditions, this can make them worse. Individuals need to be aware of the health impacts to understand the benefits of reducing or eliminating exposure to wildfire smoke. Next slide. Health impacts of wildfire smoke are not felt by everyone in our community equally. The groups identified by the Ontario Ministry of Health as being at higher risk for the negative health effects of wildfire smoke are listed on this slide and are a combination of people who are more sensitive to wildfire smoke and those who have greater exposure. People who are more sensitive are recommended to take actions to reduce their exposure at a lower level of wildfire smoke than the general population. Regardless of an individual's sensitivity, when symptoms appear, people need to seek relief by limiting outdoor activities and going someplace with better air quality. Next slide. The Toronto Public Health Wildfire Smoke Response Strategy is an example of our engagement in response to climate change and work that was prioritized in the 2023 Population Health Profile. The strategy identifies the different roles and responsibilities across Toronto Public Health as part of our response. It outlines collaboration with other city divisions, such as Toronto Emergency Management, to ensure coordination and collaboration between divisions. It is also a requirement of the Ontario Public Health Standards to be ready to respond to sudden deterioration in air quality due to wildfires, and to have a plan to alert our community of this health risk, including people with information to protect their health. To update the strategy, we consulted with other areas that have more experience with wildfire smoke, particularly in Western Canada, reviewed the limited amount of local epidemiologic data for the last year, and we scanned information sources such as scientific studies, best practice guidelines, and the media. Next slide. Toronto Public Health has a 3-level response strategy to wildfire smoke. It is linked to wildfire smoke special air quality statements or air quality advisories. Both of these are issued jointly by Environment and Climate Change Canada and the Ministry of Environment, Conservation and Parks. Most of the time we'll be in the monitoring phase, looking for a forecast of deterioration of air quality caused by wildfires. We do this through special bulletins issued by Environment and Climate Change Canada that provide advance warning of a potential wildfire event that will impact Toronto. And we also monitor publicly available models that predict the current wildfire's path on a continent-wide basis over the next 48 hours. So should there be a special air quality statement, that is when we go into the activate phase, and that's when the Air Quality Health Index, or AQHI, is on a scale from 7 to 10, when that level is 7 to 10, for greater than 2 hours. The statement will have a number of health messages that we've already discussed about what people can do, and we reinforce those messages and stress the importance for people to take action. If the situation is worse, then there's an air quality advisory issued, and that's when the AQHI is forecast to be greater than 10, and we will move into an enhanced level. We will reinforce the messages we've already discussed, particularly those for who are at higher risk of health impacts. And we also highlight the presence of the cleaner air spaces, which I'll discuss in the next slide. And we'll work with our partners to make their clients aware of the air quality situation and action these people can take to protect their health. Next slide. New for this year is the city's Cleaner Air Spaces Network, done in collaboration with Commercial Real Estate Management and Toronto Emergency Management. It consists of a number of publicly accessible city locations where individuals can be assured that the air is filtered, reducing their exposure to particulate matter. These spaces are available to the public at any time the participating facilities are operating, and not just when there is a wildfire smoke event. This will lessen the chance of confusion as to when these places are available. Since this is the first year for this network, we're going to evaluate its use to guide development for future seasons. Now I'll pass the presentation back to Dr. Finkelstein.
Thank you. It is important to take this opportunity to reinforce the steps everyone can take to protect themselves against the health impacts of wildfire smoke should it once again impact our region. Follow the advice that we are going to provide and other agencies will also provide to rely on the Air Quality Health Index. It provides evidence-based recommendations on how to alter your activities outdoors in relation to the air quality. Protect yourself also by maintaining your indoor air quality. First is to reduce the particulates that you produce in the home. And if you have a forced air system, maintain it and install the highest filtration possible that is compatible with your system according to the manufacturer. If you don't have a forced air system, consider other ways of filtering the air, like purchasing a portable air filter or constructing one yourself. Help reduce contributions to outdoor air pollution during smoke events by reducing energy use to reduce other sources of air pollution. And if you must go outside when air quality is particularly poor, and if you feel symptoms or if you have increased risk of short-term health impacts, consider using a mask to reduce your exposure to components of wildfire smoke. Next slide, please. Finally, now that we have completed our update of the strategy, we are continuing to look for inputs that will further our work. We are working to incorporate the wildfire strategy into our climate change surveillance framework that is being developed and will be reported to the board in the first quarter of 2025. We are watching and learning from the examples of other jurisdictions who are responding to wildfire events this season to learn more. And finally, the Partnership of Healthy Cities awarded Toronto Public Health a grant to conduct a survey focused on extreme heat and wildfire smoke to collect information related to residents' experiences during the wildfire episodes of 2023. And those results hopefully will be reported next year. And so I'd like to conclude the presentation and thank you for your time.
Thank you very much. Any questions from our folks? Seeing none, you're very efficient. Any speakers on the item? Seeing none, okay. I will move the item. All those in favor for receipt? Opposed? Carried. Thank you. Next item is item 14.3, Toronto Public Health 2024 Risk Management Report. There is not a presentation, but there are speakers on this item. First person is Jeffrey Goodman. Are you here? Okay, you have 5 minutes or less. Okay, go ahead. Okay, you can give it to the clerks, they'll circulate it, but in the meantime, you could. Okay.
It's a single copy, but to let you know there are scientific studies backing up what I'm going to say.
Okay, go ahead.
In my comments, I'd like to be here and I appreciate the opportunity to address the Board of Health. And Dr. Davila's comments.
Speak into the mic.
And Dr. Davila's comments led me to think about some things today, which is that always the committee is looking at the best evidence available. And I think things are changing, and I hope the committee will be open to new evidence as it emerges. It seemed to me that right now the committee views that the best way to deal with COVID-19 risk is to vaccinate everybody. And I think there's growing evidence that says that may not be the best way to deal with risk, especially among different populations, especially among younger people. I would like to remind people that in the past, therapeutics have been approved and spread widely and been found out much later to be a serious danger to the people who are taking them. You could look up studies like Vioxx, where 600,000 people died of heart attacks, but it was an effective pain medication. But the side effect, the unintended consequence, was heart attacks. We could look at smoking. Many doctors spoke that smoking was fine and cancer wasn't a problem. Years later, we find out smoking causes cancer, and those doctors were wrong who publicly spoke about it. You could look at thalidomide, which was good for morning sickness, but had an unintended consequence. So I think the landscape is changing on COVID-19 as being a safe and effective therapeutic in all cases. And my hope is that the committee would begin, maybe a subcommittee, maybe a staff member, to start looking at some of the alternative studies that are coming up. And I've handed over 4. I think North America may be behind what's going on. Some jurisdictions seem more willing to look at the data and to compile the data and present it. A very important event is the College of Physicians and Surgeons in BC is in their disciplinary committee on a doctor who spoke out about COVID-19 vaccine, just decided that they would not accept judicial notice for the evidence regarding his case. They're saying, we want to hear the evidence. And I think this will eventually apply to public health in Toronto, that when you make decisions, you have to make sure you have all the evidence. The committee in BC said, just saying the vaccine is safe and effective is no longer acceptable as a defense. You need to be able to prove it. I think there's a lot of data, if a staff member wanted to look at it in places like Our World in Data, that has a lot of information of what's going on around the world. You can look at Sweden, which followed a very different program than we did and had more successful results. There's an organization called React 19 that has 3,850 peer-reviewed scientific studies on its website. Are people, so is the Board of Health looking at this? Are they looking at the possible risks that come? We know that myocarditis is now accepted as a black box warning on the vaccine itself. So there's always, the Supreme Court of the United States said that vaccines are inherently unsafe, which is why they gave liability immunity in the United States to the vaccine companies, because vaccines are inherently unsafe. There's always side effects. So the question is our committee, your committee, monitoring what these negative side effects may be And are they overcoming the risk-benefit analysis? So thank you very much.
Thank you. Any questions for the deputants? Seeing none, thank you. Karen Ruckus, I believe you're online. Are you here? Karen? If you're online, you could unmute yourself.
Okay.
Okay,
There.
I could hear you now. 5 minutes, go ahead.
Oh, wonderful, thank you. I'd like to speak about the challenges of mis and disinformation mentioned in your report. It is important to remind ourselves that what started out as disinformation or fake news ended up being truthful, such as the lab leak theory. Conversely, what started out being scientifically based public health guidance actually turned out to be mis and disinformation, and I'm going to share a few of those with you. Number one, the mRNA vaccines were 95% effective in preventing infection from SARS-CoV-2. This assertion was discredited soon after the first vaccine series was administered by mid-2021. Number two, when you take the vaccine, it prevents you from transmitting the disease to others and keeps granny safe. Well, on October 10th, 2022, a Pfizer executive testified at the European Parliament that their product was never tested to see if it prevented transmission. In fact, in the Parliamentary Library in Ottawa, look for Order Paper Question 2554, whereby PHAC and NACI acknowledged in December 2020 the uncertainty around the vaccine's ability to prevent transmission. Number three, vaccine immunity is better than naturally acquired immunity. That has never historically been the case and is still not. Number four, the vaccine product stays in the arm and the mRNA degrades in the body within hours. That so-called fact was disinformation, as several studies, including Pfizer's own biodistribution study, showed that this is not the case. In fact, the encapsulation of the mRNA in lipid nanoparticles and the substitution using N1 methylpseudouridine were used in order to keep the mRNA intact in the body for longer periods of time. The principal consideration that won doctors Caitlin Carrico and Drew Weissman the Nobel Prize. Moreover, the mRNA particles and their spike protein load are dispersed throughout most of our organs, including the bone marrow, and in fact, they cross the blood-brain barrier and the placenta. Misinformation number five, masks work to prevent the spread of an airborne disease. Well, in 2023, a Cochrane review of 76 studies dispelled this myth by concluding, quote, wearing masks in the community probably makes little or no difference to the outcome of laboratory-confirmed influenza/SARS-CoV-2 compared to not wearing masks, unquote. Misinformation number six, the infamous 6-foot social distancing rule, which Anthony Fauci testified just last month that it came from, quote, nowhere, without any scientific foundation. Number seven, 2 weeks to flatten the curve. I don't think I need to say anything more there. Number eight, mRNA products are safe in pregnant and lactating women. Since the beginning of modern medicine, we've always applied the precautionary principle when it came to pregnant women. We learned a valuable lesson in the 1950s with the thalidomide scandal. But in 2021, we were given misinformation about the use of this warp speed vaccine for pregnant women, even though the drug monographs themselves from both Pfizer and Moderna never gave these assurances. In fact, in the Parliamentary Library in Ottawa, you will find another order paper question, question Q2163, which was produced by Health Canada on December 13th, 2023, just 7 months ago. And it said, quote, none of the COVID-19 vaccine manufacturers sought indication for use in pregnant or lactating women or submitted RCTs in pregnant/lactating women for regulatory evaluation. The product monographs included statements about the uncertainties related to pregnancy and lactation, unquote. Health Canada went on to state in the same order paper question, quote, Health Canada has not approved any safety claims with regard to pregnant and lactating women, unquote. So exactly who were the purveyors of this mis and disinformation? These were statements which came directly from public health officials, politicians, and TV doctors. So what can we learn from the COVID-19 vaccine? The COVID-19 pandemic. Science is always evolving and must be challenged, particularly when the data comes directly from the drug manufacturers themselves, who stand to make enormous profits.
10 seconds.
Okay? We cannot be afraid to challenge Health Canada when 80% of their funding comes from big pharma, who rely solely on the data arising from drug manufacturers' own clinical trials and post-marketing surveillance.
Any questions for the deputant? Seeing none, thank you for coming in. Daniel Freiheit, are you here? You're online? Daniel?
Here. I am here.
Okay, you have 5 minutes. Go ahead.
I'm glad to see the delegations coming in on the COVID stuff, because I saw that the noise the individuals raising issues, concerns about the noise, formed a coalition, and I think that's great. And by the way, fully support the noise cause. I think it's noise is a big health issue. I recall once traveling with some children on an airplane, and I asked, "What can I do about the noise of children? Like, how, what can I bring on the flight to assist in dealing with the noise?" And they said, "Bring 300 pairs of earplugs." So earplugs are definitely something to consider to some extent. But anyhow, to the issue of this board's strategic plan for building trust, okay, for how it handled and continues to handle the COVID response within Toronto Public Health, because I know on the agenda it talks about strategies to mitigate risk, including positioning Toronto Public Health as a trusted and reliable source of information. I've been trying to work with public health for a while to make sure to temper or to moderate some of the claims of vaccine safety, efficacy from day one. Is there an echo here? Part of that was with the TDSB, who's also making claims on behalf of Toronto Public Health on vaccine safety and efficacy. I'm like, y'all are getting your information from one source, and that's Health Canada. And Health Canada is operating from limited information. So don't just take everything Health Canada saying, without a bit of a grain of salt. And anyhow, to the point of getting back to the issue of building trust within Toronto Public Health, I've asked this board to ask me questions, and maybe I'm going to stop at 3 minutes and ask myself questions, because you guys never asked me questions. I submitted a document, okay? This was a Toronto Public Health generated document, and I know there's a lot of moving parts within Toronto Public Health, and you can't control everything everyone does, especially during a pandemic. I don't know if I can pull up the document if I need to. You all can look at it, okay? What it shows, and it's been redacted because there's some, but the individual whose medical record this is has testified at the National Citizens Inquiry. She's discussed her whole case. The document you're looking at is two versions of an adverse event following immunization report. And again, this is generated by we'll call them an AFI, A-E-F-I, an investigator within Toronto Public Health. It's supposed to be the same document, but it's actually different. It's like the games you play as kids. What's the difference between these two documents? And you can see on it, I don't know if you have it in front of you, it shows that there was an insertion into one version of the record that was sent to the individual's doctor, and a different version that was sent to the patient. It should have been a blind carbon copy or a carbon copy. But what the investigator did was adapt it or change the record, and to basically, I'll say, butter up the physician to advise the physician that, hey, this patient may just be a psychosomatic response to the vaccine. So it caused the physician, and because of course the physician thinks the patient got the same version of the document. When I saw this, I was like, this is something's happening in Toronto Public Health. This needs to be looked at. I trusted, and I still kind of trust you folks at Toronto Public Health. But when I saw this, I was like, this needs to be investigated. We need like, this isn't a lawsuit will do so much. Like, the damages here, I don't know at the end of the day what they are. But this needs to be investigated. How widespread was this? I know it's very common knowledge now that a lot of physicians had issues reporting adverse events following immunization. There was pushback of all kinds. Couldn't get it in the system. Oh, it could be something else. Okay, I'm seeing we're running out of time. Y'all are gonna ask me some questions, so I'm gonna ask myself the questions. What do you want public health to do at this point? We're trying to rebuild trust. Well, glad you asked. Here's what you have to do. You have to, and it doesn't have to be me, you have to hire an independent investigator. You need to commission a report. And I know y'all are running out of money. The city's running low on cash. How do you fund this? I would say federal government. That's a squeamish conversation to have, but it has to happen. I would say special tax maybe on big pharma. It has to happen. If you want to drive this building trust, again, I'm the biggest proponent of public health. Well, not the biggest.
10 seconds.
A major proponent. Is that all I have to say? Is that all I have to say, Mr. Front? Yes, that's it. Any further questions? You can always ask me some more questions.
Thank you so much. Any questions for the deputants? Seeing none. Thank you for coming in today.
you.
Gloria Bristone, are you here? Online, you have 5 minutes. Can you unmute yourself, please? If there are any deputants in the room, please come up to the mic. Gloria Bristone, you have 5 minutes. Go ahead.
Thank you. The definition of misinformation given by the Merriam-Webster Dictionary is listed as incorrect or misleading information, and disinformation is listed as false information, deliberately and often covertly spread as by the planting of rumors, in order to influence public opinion or obscure the truth. But for me, the question has always been, who is determining what is incorrect or misleading information? Shouldn't those with differing views be able to sit down and discuss the data? If there is no debate or discourse allowed against any of the assertions established by the so-called health experts, even when the concerns come from thousands of scientists and medical doctors regarding such things as inadequate clinical testing and efficiency, substandard manufacturing and distribution, as well as possible adverse risks associated with these experimental genetic vaccines, what makes one published doctor's opinion better than another? How can we say things are misinformation if the majority of these things have been highly censored, undebated, and in my opinion, purposely ignored? Such adherence to this lack of debate was exemplified early in the pandemic when 60,000 scientists and health professionals signed the Great Barrington Declaration, expressing grave concerns about the damaging physical and mental health aspects of the COVID-19 policies. The declaration was critical of many of the pandemic measures, which included vaccines, lockdowns, arbitrary closure of schools and workplaces, as well as the quarantine and PCR screening of healthy, asymptomatic individuals. Their concerns were silenced, dismissed, and labeled as misinformation, even after Portugal's appeal court held that the PCR test could be 97% unreliable. They found the test itself was unable to determine beyond a reasonable doubt whether someone was infected because the test was dependent on the number of cycles used and the test's reliability was dependent on the viral load present. The judges cited an Oxford study which showed that someone who tested positive at a cycle threshold of 35 or higher, that the chances of that person being actually infected could be less than 3%. To brush off information that does not align with the Public Health Agency of Canada's narrative as misinformation and disinformation does not serve the public interest, and using these terms can lead to the weaponization by those in power to silence dissent and suppress the truth, as has been seen throughout history when looking at authoritarian regimes. Public health agencies largely adopted a quarantine until vaccination model of public health, which was riddled with absurdities and contradictions, fear-mongering, social disruptions, school business closures, unprecedented wealth transfer, travel restrictions, and ultimately worsened physical and mental health outcomes, disproportionately impacting the poor, marginalized children and young adults. Side effects of the vaccines are not being discussed, nor are they being researched, and individuals who have unfortunately been injured have been left to fend for themselves. Just look at Kayla Pollock. She is an Ontario woman who was paralyzed by her COVID-19 vaccine, and instead of being helped by our medical system, this young mother was offered MAID, medical assisted suicide, 3 times. Public health messaging has been and continues to be that side effects related to the COVID-19 vaccine are rare, but based on the adverse event reporting systems around the world and the personal impact these vaccines and pandemic measures have had on my direct friends and family, I can personally validate that adverse reactions are happening and that these people themselves are being labeled as misinformation and disinformation. There are many Canadians suffering under the guise of being rare or being ignored due to the label that vaccine injuries are misinformation. Take Diane Spalding or Kareem Rajani as examples. Both Toronto residents, both injured by their COVID-19 vaccines. Diane suffered bruising and petechiae, tremors, and extreme fatigue after her first AstraZeneca. Kareem suffered pericarditis and myocarditis after his booster dose of Pfizer in December 2021 and has since developed severe neurological issues. If public health is to be trusted, then public health messaging and public health agencies need to start being honest with those that they represent and allow scientists and doctors to discuss and perform the science without the threat of regulatory reprisal. As an example of truths being labeled misinformation, I'll bring your attention to an Ontario doctor. In 2021, Dr. Byron Brylet, along with 2 of his colleagues, wrote an open letter to Health Canada requesting that AstraZeneca not be used, in part on the grounds that it was being investigated for a link to potentially fatal blood clots in many European countries. At the time, he was accused of spreading misinformation, but under 2 months later, Canada suspended the AstraZeneca vaccine program, deeming it to be too unsafe as a result of blood clotting. And in May 2024, AstraZeneca finally withdrew its vaccine worldwide due to blood clotting and platelet issues, which at this point had been known for years. If you want to rebuild trust in public health, honesty, debate, and allowing scientists and doctors to discuss.
Thank you. Any questions to Deputant? Seeing none, thank you for coming in today. Next up is Elena Bonella.
I'm here. Good afternoon.
You have 5 minutes. Go ahead.
Toronto Public Health is facing challenges in dealing with securing public support and adherence to public health advice in 2024. This risk was assessed as very likely to occur and has a notable impact on time, cost, or quality. Its main concern is engaging individuals not following public health advice. At the top of the reasons listed on the above are misinformation and disinformation. The Canadian Centre for Cybersecurity defines misinformation and disinformation as follows. Misinformation refers to false information that is not intended to cause harm, while disinformation refers to false information that is intended to manipulate, cause damage, and/or guide people, organizations, and countries in the wrong direction. Disinformation is a threat. Torontonians are witnesses of disinformation in Ontario and in Canada during COVID. Examples of disinformation verified with facts are as follows. Public health claim number 1, combining vaccines, COVID vaccines is fine. On April 2021, our Prime Minister went public and got Moderna vaccine following first dose of AstraZeneca. Canada's Chief Public Health Officer, Dr. Theresa Tam, said the decision to combine mRNA vaccines interchangeably was nothing new. Fact check, false. Vaccines are not interchangeable. The vaccine producer, Pfizer-BioNTech, stated, COVID-19 vaccines are not interchangeable. If you receive Pfizer or Moderna COVID-19 vaccine, you should get the same product for your second shot. By the end of 2021, this statement remained unchanged. Public health claim number 2, 4-month gap between doses is okay. On March 2021, NACI said extending the dose interval to 4 months or 16 weeks would allow as many as 80% of Canadians over the age of 16 to receive a single dose. Fact check, false. Gap between doses should be up to 6 weeks. The vaccine producer, Pfizer-BioNTech, stated, there is currently limited information on the effectiveness of receiving your second shot later than 6 weeks after the first shot. Canada's chief scientific advisor, Mona Nemer, called Canada's vaccination strategy a population-level experiment on July 2021. Public health claim number 3, COVID vaccine is effective. On 2021, August 25, Public Health Ontario stated, all COVID-19 vaccines approved for use in Canada are effective at preventing symptomatic SARS-CoV infection. Fact check, false. COVID vaccine does not prevent infection. Health Canada changed its statement from preventing infections to COVID-19 vaccines are effective at helping to protect against severe illness. CDC stated in 2022 that protection against infection tends to be modest and sometimes short-lived. Public health claim number 4, antigen testing detects COVID-19 cases. On November 2021, Christian Elliott said, testing remains a key part of our pandemic response by detecting cases earlier. Fact check, false. Screening does not rule out vaccine infection. Pharmacy disclaimer providing a screening said, the screening kits approved by Health Canada contain certain limitations and may not be accurate, effective, or appropriate in all circumstances. Antigen screening does not completely rule out an active COVID-19 infection. 4 facts checked in less than 5 minutes. If more time allows, I continue with examples of this information to state true facts, such as no need to vaccinate children. COVID infection increases natural immunity. Hospitalization was higher in vaccinated people and more. My message to Toronto Public Health is trust but verify. Stop turning a blind eye to the facts. Trustworthy actions by government officials are expected, rather than changing definitions or applying force through mandates or bombarding us with expensive manipulative media ads. Reality has changed. You are not addressing the same population of before COVID. You are now addressing the witnesses, the survivors, the victims of the actions taken by the public health officials. The scars are still fresh. I close with a quote. Without facts, you can't have truth. Without truth, you can't have trust. Without all three, we have no shared reality and democracy as we know it, and all meaningful human endeavors are dead.
Thank you. Any questions for the deputants? Seeing none. And the last speaker is Mariko Ude, the last deputant. Go ahead, 5 minutes.
Good afternoon again. This risk management plan identifies misinformation and disinformation as a public health risk. What is meant by misinformation and disinformation? I won't go into that too much because it's already been covered. As I deputed last April at the Board of Health meeting about last year's risk management report, I mentioned that my PhD research was on resilience, and in order to have resilience, on the one hand, you need diversity. And then on the other hand, you need unity. You need everyone going in the same direction. But diversity is important because if that direction is wrong, then diversity can help you. And my assessment of what's happening right now is that we've gone too much, like you actually need both and you need a balance of both. But if you go one way, like if you went diversity, then we wouldn't really move anywhere. We couldn't make decisions, right? So you need to find the balance. And I think right now we have too much unity and we're squashing diverse opinions. And it's a very easy situation to get into, and it's something we have to always guard against. I myself initially thought people resisting the vaccine were ill-informed, and I actually thought I had to save my friend from going down the rabbit hole. So I watched some videos my friend sent me, and then to my surprise, these were credentialed scientists saying very logical things. I have an undergraduate biology and chemistry degree, and I have work experience in 3 different labs, and so I got interested. I went back and checked the government website, and is it indeed true that the mRNA vaccines that cause the spike protein to be expressed on the cell surface could actually go into any cell in the body? And while look as I might, the government website could not provide me with any info to say that it couldn't. If the mRNA vaccine could go into any cell, then the spike protein can be expressed on any cell surface. And so any cell, including heart cells, brain cells, immune cells, could be attacked later by antibodies to the spike protein. Well, that's not good. That could lead to heart inflammation, brain inflammation, immune cell damage, etc. And so since then, I've been coming to the Board of Health. I've been deputing here in hopes that this concern could be addressed. I do not think this is misinformation. To me, it's missed, M-I-S-S-E-D information. And I do not think it's disinformation, but dist information. In my dreams, Toronto Public Health is a leader in turning the tide. Rather than closing up to alternative perspectives, we can get curious about them, welcoming them. As I said last year, rather than seeing vaccine hesitancy as a risk, What if we looked at it as an asset, something that could save us or provide us with critical information? And I'm happy to work with anyone. Thank you.
Thank you very much. Any questions for the deputant? Seeing none, thank you for coming in today.
Thank you.
Any questions to members in-house here? Seeing none, you have a question? No, for staff. We're not taking it in-house. Any questions for staff? Okay, very brief. Go ahead.
I know we're almost out of time. I'm just really curious for the third point on challenging public support. During the pandemic, we saw you, Dr. Davila, on TV, a lot more, and I think for a lot of Torontonians, that was a time for them to see the work that public health does, and it was, more in their faces. But now that we've, emerged from the pandemic, there isn't as much, front work being done in, when it comes to the public health's presence in the media. So I sense that there may be lower public trust in public health and public health initiatives. So I'm curious how public health can, going forward, be positioned as a trusted and reliable source of information in this, ecosystem of misinformation.
So very quickly, through you, Chair, you'll note in the report there are a number of different actions that we recommend, including monitoring concerns and monitoring expression of concerns by the public. And of course, we are continuing to provide messages on all the relevant public health issues as they come forward. Again, I can assure the board that we use the best available evidence possible. That includes understanding what's impacting on the public and that which is being published within the scientific literature, amongst other things. So I'm happy to have a longer conversation when time allows, but I'll turn it back to you, Mr. Chair.
Thank you. Any speakers on the item? Seeing none, motion to adopt the recommendation. Opposed, carried. That's in our agenda. Thank you very much. We were at bare quorum.
Thank you.
Take care, everyone online. Yeah.